or Bloody Marys.
I didn't do anything for my bio. Yeah.
Okay, we up and running?
Yeah.
Okay, let's call the meeting to order. It's Tuesday, August 22nd, 2017. Please stand for the pledge. I pledge
allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Born and unborn.
Okay. Minutes and reports received and filed.
None.
Okay. Commissioner liaison reports, upcoming meetings and events.
We got leadership Friday morning. About it.
Getting in the right month. I know I have an MMRPC meeting this week sometime. Go ahead, Sam.
Okay.
I'm not even the right.
I got Cap Region Building Committee tomorrow, Thursday afternoon. I'm meeting with Governor Greitens. Boost barbecues that night. Leadership Forum Friday, and then I got a National Guard banquet Friday night. So that's all I got.
I got an RPC meeting Wednesday at noon in Ashland and a Road and Bridge Advisory meeting Thursday at 8 a.m. That's it.
Okay. Commission comments, bids and contracts, any bids, unfinished business, new business, accounts payable review.
I've asked for approval of accounts payable, some utilities, the election, and, the credit card, P-cards.
I move we approve accounts payable pending review.
Second.
All in favor?
Aye.
Aye. Discussion of tax levy for 2017.
Okay. Well, that time of year again, County Commission has two different tax levies, one for general revenue and one for public works. They're due to the county clerk on September 1st. It's on the agenda for next week, Tuesday, for the public hearing and for you to actually approve the two levies. I just emailed you guys again this morning. I don't know if it's attached or not. There's all kinds of data that I forwarded you on. Basically, the big thing we have to start with is the assessed valuation. We go from there and we figure out what the rollback is going to be because of the election we had in 2008 for the EMS sales tax, where we're going to roll back 60% of that. That goes back into property, and then we'll reduce by trying to keep that level between property tax and sales tax. So my recommendations are going to be to keep it, the general revenue at the 0.0821 for 2000 for the next tax year, 17, yeah, and then public works at 2716. And I'm just here to answer any questions, or if you guys got any kind of format you want to see those levies in. I gave you a couple what-ifs. I gave you a copy of the State Tax Commission forms that we have to fill out, and the rollback calculations. There is the assessed valuation, because the reassessment went up 1.01. There was some new construction in there also. Which it will never happen, everybody pays their taxes on time, and at the end, from 16 to 17 in general fund, if you kept the levy at the 0.0821 after the rollback, we would generate about $90,000. And again, that usually never happens because not everybody pays. Most of that is due to new construction. There's a slight amount of increase because of the balancing of sales tax versus property tax within the rollback. And then general public works, their difference would be $42,000. of increase if you left it at the 2716. So,
Yeah, I looked at all that and I'm like, oh, I'm gonna have to look at this more. That's a lot of information.
there's a lot there, a lot goes into the rollback process, so, and that really, actually, the rollback for 16, the sales tax was down. We have to take the first 6 months of 16 to figure out what to put the rollback amount at. And then when you get to 17, you gotta go back and see if you guessed right on 16. And actually, our sales tax was high, high for that first 6 months. So we had to reduce that in 17. So that may be where a little of the difference is, because it's there just to keep a balance between the two.
I don't have any questions at this time.
I don't either at this time.
Okay,
So
talk about it next week.
Yep,
This
Okay,
has already been in the paper, right?
yes.
signing of surplus title.
Actually, no, it will be in the paper this time.
Okay.
Surplus title. This is the vehicle of the sheriff's department that was totaled, so we just need to sign the title, give it to Mulper.
I move that we sign the surplus title.
Second.
All in favor?
Aye.
Okay. 2018 EMS charges.
Submitting them earlier than normal so we can, it will help us complete our revenue budget. Like I told you last year, we had not had a significant, we hadn't had an increase that we had documented since the county took it over. So I did some research and I emailed you some data that I was able to come up with on what other area services are charging, and I found that pretty much across the board we were undercharging compared to everyone else in the region. The region was broken down a few different ways by the type of service and by the area itself. And like I told you, with the last increase, it was a little hefty, but given the fact that we had not increased charges for a long time, we had to play catch up. I would anticipate this would be the end of the catch up, so this would be our charges for all of 2018. Of note, probably the one area that we're still under billing for is mileage, but I really just didn't feel right about making it higher than a 30% increase. That would probably be the one area that we would have more of a significant increase than what's generally accepted in the medical field. So my recommendation is to proceed with 18 charges. I took the liberty in my budget of anticipating that you would approve this, so if you don't approve it, then we'll have to change the revenue budget accordingly.
How does this compare with like Boone County, Osage County, Mid-Mo?
We're lower than Boone and University. We're right in line with the rest of the agencies with this
With
increase.
this, okay. So this is basically what they're charging?
Right.
Okay.
There's some that are a little higher, some are a little lower, but across the board, we're about what would be considered average in the region.
We just made some changes here not too long ago.
March of 17.
I was trying to just take a look at where we were.
But at that time, we were still
Earlier this
using
year.
the charges from 2008, 2009.
Basically, yeah.
So, I mean, we hadn't gone up in, since we took over the,
Right.
yeah.
And like I said, I understand that this is a fairly hefty increase, but at the same time, it basically brings us, the last column over there shows what the averages are in the region. And with rare exception, we're pretty much under the average of every charge in the area.
So when we look at mileage and non-covered mileage, I mean, what are we talking about there?
That's an example would be that's mostly for billing. An example would be that insurance and third-party payers pay to the closest, most appropriate hospital. So the patient still can request to go to another hospital, but it's billed as the difference in the mileage is billed as non-covered because Medicare and third-party payers won't pay that. I'll give an example. If they need a procedure done and CAP offers it, but they want to go to Columbia, they'll pay for the mileage from their residence to CAP, but the difference to go to Columbia, they're on the hook for.
So is that $20 a mile?
Yeah. We don't, most places don't discern between the two. We leave it all the same. It's mostly for billing. That code you see is an automatic denial code for Medicare. The other thing that this does is, I don't know if you want to call it an aside benefit or not, but you'll see when I talk about my budget that as long as you're not overcharging folks and billing folks that use the service, you can reduce your reliance on taxes and subsidies. And so, again, you'll see in my budget that by charging an appropriate amount to the people that use the service, you make the service, help to make the service more self-reliant.
I guess, I mean, not opposed to looking at these. I mean, do we need to implement these today, or?
No. No, we just,
I mean, obviously, it's going to affect your budget if we don't approve them. I mean, I guess one of the questions that comes to mind for me is that are the increase in revenues due to the increase in the fees that we're charging? And then, obviously, some of these are a pretty big jump too. Will the increase going forward from if we implement these, will our increase in revenue be because of the increase in fees? And I was kind of hoping that our increase would be from the number of runs that we're making and operational efficiencies versus just the increase in fees, or a combination of both. So
it's a combination of both. It's mostly on the volume. And again, roughly 50 to 55% of everyone we take in the ambulance is Medicare. So you can charge $10,000 to Medicare, and you're going to get the Medicare allowable, and you have to write off the rest. So that's why I say you have to be cautious when you look at prices for EMS, because big increases don't come through as big increases. They come at a smaller incremental pace. I think we've maximized our big gain that we were going to see. We'll see a gain from just the fee increase, but at a smaller rate than we've seen up until now. It's going to be volume driven from here on out. What we needed to make sure was that we were maximizing and capturing our Medicare fees, and we're doing that now.
I think if we stay at 1,000 calls a month or somewhere around there, it's gonna go up, but, you know, if we're the cheapest around, I don't think we necessarily should be the cheapest around. I look at us as being maybe, you
That's
know.
why I targeted the average. If we feel like we're providing superior service and charging among the average amounts, I think that puts us in a good spot.
Do we, I know someone had said that Osage offered a discount to Osage County residents. Have we looked at that from any service to see if there was any discounts?
That's a philosophic discussion that we could entertain. The thought is, I know a lot of places do that, particularly tax-supported or subsidized services do that. The feeling is that you help to pay for the service once, so you give a discount to the in-county residents. We'd have to do some math on that to see what the budgetary impact would be based on whatever amount of discount we decided to offer, because obviously most of the patients that we transport are Cole County residents.
Okay.
But we wouldn't charge more if we had to go to Osage County and assist them and transport people.
You can do it two different ways. One is you can offer a discount based, you have your charge and then a discount to Cole County residents. Or you have your set charges and then you have a increased charge to non-county residents. You can do it a couple of different ways.
But right now, we don't have
We don't
an
do
additional
anything.
charge. It's just
No.
mutual aid, and we charge the same whether we're going to Montauk or Miller or Callaway or,
Everybody pays the same right now.
yeah, Osage, they pay the same, so.
What do you think, Jeff?
Looking at some numbers and stuff. As long as they're fair numbers, I don't have a problem with it. We already raised them once this year, and we can look at it again. You had indicated that we were trying to just get close to the average price, and, you know, there's one where we would be actually over, so wouldn't we just want to leave it alone? I mean, there's probably little things that we can play around with, and but overall, I'm not opposed to it. If you're using a service, you need to be paying for it. And we saw we were way undercharging back in March.
Do we want him to use these figures when he's figuring his budget?
I already have.
Okay,
So
okay.
if, I'm not asking for necessarily any action today, but just a little bit of guidance. If you think this is the direction we're headed or close to heading, we can change it on the fly as long as we can, you know, in the budgetary process. My budget's already been built based on this. So if we decide we don't want to charge this much, then we'll need to back some of that out based on what changes we made. But I was really more interested, I realize this is really early to approve anything for 18, but at the same time, we were going to need some guidance moving forward with the budget to build the revenue side. So it's your pleasure how, if you want to approve these today, if you want to just take it under advisement and tell us we're heading down the right direction, so at least we can continue with that in our budget discussion. I don't have a bias either way.
So your charts where you compared low, average, and high, or low and the high, I mean, which services did you compare to, or did you just?
They were, that other attachment in your email, it broke it down a couple different ways. One was by geographic region, and the other was the type of service, whether it was a public service, county-supported service, all services combined. It broke it down differently. But we were generally under in all the categories.
Who are the ones that are the high charges? I mean, how are they able to charge that?
Like I said, you can charge whatever you want. The services that do that hope to capture that from private insurance. So that's the private insurance's beef against Medicare and some of the other fixed payers, is that they're subsidizing their part of the share. But an example would be some of the services on there that you see maybe charging $2,000 for a call. They're still going to get $300 or $400 for Medicare, and they have to write off the difference. But if they get 80% of that from a third-party insurance biller, they've come out way ahead of someone who's charging $1,000 for that same service. So that's the thought.
But this doesn't put us higher than Midmo or
No,
Osage
no,
or
we're right in line
Callaway.
with everybody in the region.
So, I mean, that's my thing. We don't want,
You know, there's so many, these are charges based on acuity and what the federal government decided about 15 years ago that how they were going to parse out and break down the charge structure in EMS. So, you know, there are some that were a tick over and some that were a tick under, but at the end of the day, we're really close to being average for across the board.
You guys want to approve it today, or?
well,
I'd soon take it under advisement.
Okay.
We'll talk about it more when we get to the budget.
I'd also like to see if there was some way, something that we could figure out if we transport Cole County employees or dependents on our health insurance, that we could circumvent the insurance since we're paying. So whether that be a direct charge that they wouldn't go through their third party. I mean, that's not gonna happen all that often, but you know, you probably got, what, 400 people with dependents probably on insurance coverage. So there's no sense us paying the full fare, going through a third party, going through all that, when we could just pay it direct.
If you decide to do that, we can set that up directly with the billing company and just change the flow for county employees. We can flag it. That's not an issue.
Just be a way for all of us to save, since we're paying the premiums anyway. So.
okay. Okay, thanks, Jerry. Refund of overage from tax sale.
Good morning.
Morning, LV.
Larry.
This is, I emailed you all this. Copy of the request. This was on
Thanks, sir.
a piece of property we sold at delinquent tax sale last year. The prior owner of the property did not choose to redeem the property and instead has requested the overage from the tax sale, which is that $5,620.92. Attached to that is a copy of the title search that we had done prior to selling the property that shows that she is the owner of the property. By statute, she has to request that money from the commission. Right now it's held in the treasurer's surplus account from all the tax sales, any of the surpluses that we collect at tax sales for over the taxes and cost associated with it goes to the treasurer. If they're not requested within 3 years, that money is then dispersed among the public schools in the county. So basically, I just need you all to vote to approve the refund of this so that the treasurer can release the funds.
I'm fine with it. Are you gonna have him write a check to you and then you issue a check to Ms. Ruberg if we approve it, or?
He has not, didn't answer my email the email where I had that in there, so I'll get in touch with him after you all approve it. And
Okay.
So is it sale less what she owed in taxes, less?
Right, this was
less the
over
title
what the
search?
actual,
Right.
all the cost involved were with the sale.
Okay.
So all the taxing entities have already been made whole from the delinquent taxes for the previous 3 years.
So what do we need to approve here, Larry? The excess
Uh,
proceeds?
Yes, the surplus
Okay.
or overage of $5,620.92.
I move that we approve the surplus payment of $5,620.92 as an overage to Mrs. Sandra Weberg.
Second.
All in favor?
Aye.
Okay.
Thank you.
Thank you.
Moving right along. In-house 2018 budget discussions by departments, and we're only 25 minutes late. Following their schedule, Jerry,
What's the closed session on there?
personnel.
We're doing that at what?
I guess as soon as we
Yeah.
get this done, that's why I brought you a candy bar.
Okay, well, the budget process starts. As you know, the budget needs to be to the auditor's office by September 1st. We've always taken this time for you guys to look at the departments that are under you, their budget. We did ask them to come today if they had major changes within their budget for the 2018 year. So we kind of scheduled everybody. Now, I don't know if everybody's wanting to talk or not talk about their budget, but I think Kristen did give you some reports out of the system for the percentage of change from 2017 to 18 and the dollar amount of change. So if there's any account you guys want to look at, we can look in the system, look at what information they put behind there, if they listed the details of it or if they have not listed the details. It's truly up to you. You can let this budget go, all these budgets under you go to the auditor and then wait till November until the auditor's office is done with the budget, or we can discuss each line item, however you guys want to do this. Or if you want each department to talk, if they want to talk about their budget.
Highlights would be my preference.
Highlights by each department.
Yeah.
Yeah,
Highlights and big changes.
All right. Jerry's first on the list, so I'm going to let Jerry take her.
I guess to go first.
Yeah.
Yeah,
Sorry.
yeah. You're all right. You don't have to sit here and listen to everybody.
Yeah, then you, well, no, I just gotta pay back for closed session.
So, just in a nutshell, what I wanted to do and what I want to do over the next 4 to 5 years is reduce the reliance on the tax subsidy for EMS and make it more self-sufficient. So, again, if with any kind of an increase will come an increase in revenue. The revenue numbers that you see here are projected based on the numbers that I gave you, but are easily, maybe not so easily, but we can put a factor in to change those fees. And the reason it shows a 28% increase is it's a combination of what we saw for volume increase this year, what we project to see based on industry numbers for volume next year and our overall increase that we put in for. So I think I grew the budget by about 9% on the revenue and the expense side. I reduced the tax asking. I don't remember the exact number. Where is that here? Is that here? Is that on here? The tax appropriation? What's that?
Transferred in.
Okay, so it's 58,000 less, so it's 5% less than last year. Last year it was 1.03 million. I asked for 973. And my main focus is on continuing the infrastructure with capital and taking care of the staff with training and wages. Everything else is pretty close to the same.
Why is there such a big reduction in the cash forward? Maybe you don't know that. Kristen?
Spent a lot of money this year.
Kristen, why is there such a big reduction in the cash forward?
We had a fairly large cash forward going into the year from last year. I mean, spending this year.
Okay.
Spent down his contingency by about 70-some thousand.
She made me make that contingency 500. I didn't think we needed 500. She made me.
869, didn't look back, that's where it was before last year. I think last year we just went into the year with more money sitting in the bank than usual.
So that's what we had in there for last year, but it was actually higher?
No, we had more money, that cash forward is just the money sitting in the bank on 12/31.
Okay.
So at 12/31/2016, there was more money sitting in the bank than there had been in prior years. But with all the changes that we were making, we were not spending as much the last 6 months of 16 as we had in other.
And will you actually put that, when will you finalize that number?
I guess I don't get that. I
So
would think
you'll
we'd have
actually
more
plug
money.
that in?
Right, it'll be whatever it is.
Okay.
I would think there'd be more money in there than less for 18.
There's 1.2.
There's
but
1.2 in there right now.
We got a lot of payrolls to go and bills to pay and revenue to come in, but.
Right.
That's probably conservative.
So it's just a guess?
Right.
Okay, all right. That's what I wanted to know. Okay, keep going.
That's it, basically.
Okay.
Like I said, the changes that you see there are, I called the hospital materials management from my old days in the hospital. I remember they had their finger on the pulse of what medical supplies were doing nationally. So basically, if there's a bump in medical supplies, it was for the increased revenue, you use more supplies, and what the bump would be that we would expect to pay for a price increase. We are going to do a bid. It's time to bid the medical supplies, so I'm hopeful that that will prove favorable for us. But basically, long and short of it is, more revenue, less tax, take care of the people, and get them outside of Cole County to do some training, to see what's out there.
I know we had some transfers between the, I don't know, like parts and repairs and stuff this year because we were classifying them different. Did you make those changes?
I made those changes. We decided to leave it as part of it was my new guy confusion, but
Okay, so where they
since then
are,
we've got
where
it
those
sorted
from?
out, yeah.
Okay. I know we had those coming across when we talked about that, and I didn't see a whole lot of difference on there, so.
So.
And I guess there was one other big change that reminded me. It depends on how you want to account for this, but I believe we can run our ambulances 200,000 miles instead of 150. Historically, we've We've remounted them or bought new, depending on where we're at in the remount cycle, at 150,000. So somewhere, I put it in, I believe, parts, but I put an engine and a transmission. Now, if you want to make that contingency, I can back that out. It's in the notes. I just called the GM guy and said, if I junk an engine on an ambulance, what's it going to cost me to replace it? Same with the transmission. So we just need to know that we've got to have some money somewhere should that happen. I don't anticipate that it'll happen. In California, we rent our ambulances 300,000 miles, and if you needed an engine replaced, unless there was a critical parts failure, it tended to happen after 200,000. But as we're living and learning right now and extending the lives of our vehicles, so I just thought it prudent to have money set aside if we need it. Where you want to keep that money, if you want to just go immediately to contingency and get that, we can do that. I put it in, I think it was parts, but it's in the notes of what it would be. So that was a departure from what we've done in the past. And like I said, I would be surprised if we needed it. If we do, it's more likely a transmission than an engine, but they're, in the big scheme of things, cheap. They're not cheap, but they're cheaper than engines. So that was the only other item of note.
So I see a $8,000 increase in medical equipment. What is that?
We need to begin, I don't have the, Debbie, could you pull up the notes? Okay. We're going to need to begin to replace some items that we have not replaced in the past. First aid bags are the bags that we carry our equipment into the scene. Those are about $300 a piece. Traction splits, not only are ours old, they're outdated, and there are newer technologies that the orthopedists want us to use, and actually they're quite a bit cheaper than what we're using now. The ones we're using now are about $800 a piece. These are more like $200 to $300 a piece. The ones you see zeros for, I was asked to take those out and put those in capital. And the lift is for bariatric patients so that we can save on backs. It's a cushioned way to lift really heavy patients that weigh more than 500 pounds, which we have quite a few. And the thought is, at $2,000, we're not carrying one in each ambulance. We'll keep it in the supervisor truck, and on those patients or where we have to get them off the floor, we can respond to supervisor, and they can do that, and we can save everyone's backs.
Okay. And then awful large increase in meetings from 5,500 to 35,000.
Well, I lumped everything together.
Or 40,000 actually.
Yeah, so part of that was I put everything together in one line item, but that was, we have an issue here of, we only do it the Cole County way. And there's things that can improve patient care. There are things that can improve system delivery and make us more efficient. We just need people to get out and see that. I'm aware of it, but when I talk about it, I get winces and looks that it's not going to work in Cole County. It's never going to work in Cole County. So I want to get, this isn't for me, this is for staff to get to state, regional, and national conferences and trainings so that, again, it's not only is it a commitment to our staff, but it's it will make us a better EMS system in the long run to get to some of these meetings. And at least 2 of those are for Dr. Ludi to attend medical directors conferences as well.
Okay. And then
Jerry, what's the paramedic scholarship?
We want to I did some checking, and a lot of places provide paramedic tuition for their EMTs to become paramedics, with the understanding that there's an agreement in place that they'll work for us for X amount of time. We'd like to be able to do that to help defray the cost. And again, the need is for paramedics. There's not an EMT shortage in Missouri or in the nation. There's a paramedic shortage. And I can tell you right now, we have open applications. We have had since I started, and we have no paramedic applicants. So again, a way to pay for our people, to upgrade their training, to and we get use out of them as a paramedic. So we put that in, and also critical care. The university offers a critical care intensive course. I think it's a 2 or 3 week course in total. It's over a couple months, but they only do it 1 day a week. And it's for us to do the higher level transfers. It just gives us a better, more well-rounded education and approach to do those high level transfers with events and all that. And I'd like to send I put 4 in, 2 to 4 folks a year through that training at the university. They only offer it twice a year because they have to provide clinical training as well. So that's what that is.
Then we have training, an additional 4,700 and or 40. Where am I at now? 4,200, and then organizations an additional 4,700.
The training, we are affiliated with the university to do all of our in-house training through, and they charge us for that service, and that's basically for that. Like if we do a CPR class, it's about $7.50 per person to run the records through and to get a card for everybody, and it doesn't matter if it's a employee or a citizen. And so to be honest, I've talked to Kevin, I find that cost prohibitive, but that's the system that's in place here right now, so we have to live with it. I think in 18 we need to look at becoming a standalone training organization ourselves. That's not without cost itself, but at $7.50 a card as a training organization, we can get that to about $1.50 a card, $2 at the most. So I think it's something that is an investment in our future, but for now I just had to leave it as it was because I've not worked in a system that charges for cards for public CPR. There's kind of a philosophy that you disseminate it widely, and we offer that training for free, but we pay for the processing of the fees for those folks. So that's where that comes from.
Okay. And then just additional organizations that you're wanting to?
The biggest one was to get Dr. Ludi in with the medical directors, to get him information on medical director. It's the National Association of EMS Physicians, and I didn't tell him this, but I wanted to get him to be a member of that because he gets information on what's happening in the EMS world from the medical director standpoint, and things like, we're talking about trying to reduce our drug inventory right now without hurting patient care at all. He will have all that information at his fingertips, being a member of that organization. I think that was the only one that I added from what Paramedics Plus suggested when they were here.
Okay, and then uniforms, you had quite an increase there.
I'll be honest, we've got to figure out a way. Those are numbers based on what we're anticipating with new employees and existing employees, but we've got to get a better process. I don't believe that we're going to spend this amount of money. That also includes coats for everyone, by the way. But I don't think we've got a good process in how we are replacing uniforms, and I'm not sure that we're getting the useful life out of the uniforms that we need to, and that's one of those things that is high on my list to get us to figure that out.
We talked about the coats a while back. Are we getting all new ones, or what did we decide on that?
What are we doing? Half.
Eventually, we have to get everybody a new
Yeah.
coat, because remember, part of it
What happens
was,
when they leave?
What, 17?
yeah, part of it was we quit buying coats because they were really expensive, and they didn't meet the ANSI requirements for the DOT for working on the side of the road. So when John was here at some point, he just said, no more coats. We're not buying any more coats till we decide. Well, we decided to defer it once I came on board and he and I talked. We decided to defer it to the uniform bid. So those are in the uniform bid, and I don't think that we're going to see. Ideally, we'll get through this year without having to buy any coats. They tell me the Missouri winters are really mild here, so
You just jinxed that.
I'm gonna try and get to 18 without buying any coats. If I can do that, then the entire amount of the coats will be funded in the 18 budget. If I got people shivering because they're new employees, we didn't buy coats for them to start with, then we may have to buy a few if it gets cold quickly. But we have our sweatshirt, zip-up jackets that I wore all winter last winter.
What
Yeah, I
happens with
see
the
them.
coats when they leave?
Say what?
What happens to the coats when they leave?
They give them back.
Okay. I know we've added some folks, so obviously we need more jackets for that. But this is gonna be going to get the ANSI approved ones or whatever. Half of them for 18, or all of them in 18?
I have them all in the 18 budget right now. I'm hoping that we can
All right.
buy it, not have to buy any. So if let's say I have to buy 10 this year to get us through, then we'll reduce that number by 10 in the 18 budget. And we may not hire as many employees as I have budgeted for, but we have got to find some paramedics somewhere, or we're not going to ever affect overtime. If I can't find part-time paramedics, that's our primary issue right now with overtime is paramedics. We just don't have enough. We can't find enough. The well is dry right now. We have open applications. We're reaching out to training programs right now in a 100-mile radius to let them know we have opportunities here for part-time that may eventually become full-time, but we cannot find paramedics. So the brunt of our overtime right now is going toward paramedic. So that is actually, as expenses would be, that's hopeful that we can spend up to that amount to get more paramedics, because it will pay us back in reduced overtime.
So if we do the scholarships and move EMTs, how long is that process going from like an EMT to a paramedic?
It's about 8 or 9 months.
Obviously, the equipment services, we just got more equipment and more equipment service contracts.
Yeah,
No,
that's mostly the CAD. That's mostly the effects of the CAD, and actually, I think that's about it.
And then the fees, I guess, are just the fees that we get charged for the medical billers, or,
Yes.
Yes, that's all.
okay, so increase.
And that went up because they
Increase in
pay
revenue.
based on revenue.
Right, okay.
That was flat. I think they're 6% of the fees, so we built, that will reduce. If we reduce our charges, that line will reduce.
Then are we gonna go over capital, or?
We can't. There was an email that he submitted along with his budget that had the capital request in it. I just technically don't have it in the budget loaded in at part of that budget, but just get to it here. capital in there is the sales tax that it generates, plus whatever carried forward that we have in here that's estimated interest, and then the big one going back is the transfer out into general revenue for the 60%. Also a transfer out to balance the EMS enterprise fund, and then the capital that's remaining. And so I don't know if you guys have that email with the list of capital.
I pulled it up. The transfer in is for coming from the sales tax, is that right? And the revenue side?
This is 650. There shouldn't be any transfer.
I'm talking about his original budget.
Oh, like his?
Yes.
Yes,
Yes.
okay. So the amount transferred in is reduced in 18?
Yes, he's got it reduced. I didn't know that. I put it in at the same as what
Okay,
it was
that's
this
fine.
year.
Transfer in, I didn't, Kristen did that. I didn't know what that, I blame Kristen. Transfer in.
We got it.
Remember, you did that calculation, right?
No, you changed.
Oh, wait,
It's three.
okay,
It was
yes,
to balance your budget.
Right.
You plus what you did
that's
to
right.
balance
It
your
was the
budget.
other, the cash forward or something that you did, right?
Yes, that's
Okay.
what I did.
Okay.
So there's the list. I think that's the final list that we received through that email. UTV, 30,000 land, and then 30,000.
List. I didn't bring that list, did we? I thought I had it.
Behind you.
It's on the screen too.
So,
So I want to reduce the ambulance fleet by one. How we accomplish that can be, we can either do it through attrition, where we just let one of our ambulances get to, 200, 250,000 miles to the point that it either needs some significant repairs, and then we just decommission it, we sell it, we take what we get and move on. Or we continue down the path of trying to not have to do too many remounts through the course of the year. So that's why I said that we all agreed in our group that the remount could wait if the pleasure of the commission was to just reduce the fleet by one and move forward. That can wait. The transit van, part of the reason for the transit van was we see the increased utility, and if we put a BLS crew on as part of the budget proposal, which we have, I mean, not as an additional crew, but making one of our existing shifts a BLS transfer crew, we're going to need a vehicle for them when that unit is down for repair and all that, so that they're not having to run a regular ambulance during that time. We could do that, but it seems to me we'd have more efficiencies by reducing our fleet by one and having the transit as that backup vehicle, because we can do 911 calls in those, not ideal, but if we had other units down for scheduled maintenance or whatever, and we had to press that into service, we could do that. So we're reducing the size of the fleet and reducing our reserve units by taking a larger ambulance at about 150 or 60,000 down to a transit van at 90,000. So of the two ambulances, the transit van we felt was a better value than the remount. We just had the remount in there to talk about how we were going to continue to go down this path of doing the remounts, with the understanding that we were going to move our entire fleet from 12 to 11.
If you have two transit vans, I mean, you can use both of those for transport.
Correct. So
So, I mean, it's not, I mean, you're not having one in reserve.
not
gonna
sitting,
be,
no,
it's
right.
gonna be used for,
it'll be used for other transfers. We'll have the BLS crew doing transfers all day, and if we get another long distance transfer, we'll put a nice comfortable chair in there for the sheriff's deputy to ride in to go to Windsor.
Really, man? Really?
I had to get you in here somewhere.
You have been pretty quiet. That's
I
scary.
know, yeah,
there was the eclipse that wore him out.
that's right, I'm wore out.
So your total number of ambulances would go to 11, and
You
two
made
of
it wore
those-
y'all out. Y'all weren't even working.
but if we had two, you gotta get rid of two. You actually gotta get rid of three. Because don't we have 12?
We have.
We currently have
right
12.
now. So the thought is to go to 11, and two of those would be so yes, you're right. We would go from 12 boxes to 9 with 2 transits. That's the long-range plan. I want to do it incrementally in small steps to make sure we didn't overshoot the target. So last thing I want to do is not remount an ambulance that could have been remounted and then have to come back here in 2 years and say, well, we missed our target, now I need to get another type 3 box ambulance. So that's why we wanted to go slowly, and 18 will tell us where we need to be, I think. So we could actually, we could take the remount off, and I'll be honest with you, that's what, we put our group together that helped craft this entire budget, and we ranked these in order of need. The remount tended to come down at the bottom, again, because the main reason that was in there was just to keep us at pace of where we're at, and not have to get in a year. I don't want to have a year. To me, 2 ambulance remounts is enough here. I don't ever want to be in a position to have to do 3. So it was kind of to keep us ahead of the game because we didn't know where we're at. But I think we can, again, with the lengthening the mileage of the ambulances, and with the understanding that the volume, our volume's going to have to get fixed at some point unless we go down the increasing the staffing path again, and I didn't budget for that. So that's why I think we'll be able to reduce by 1.
So Jerry, not to skip ahead, but the cots that you have on there, we currently have 10 cots, right? So we would only need 1 additional if you're going to reduce.
We need 2 cots, so we can have that conversation now, or we can have it later. We got to get these cots. That was the #1 priority of the group that did the budget. So we've got the $20,000 grant that I emailed you about, that we have to have our money spent by October 3rd or October 7th to put in for the grant to get reimbursed, to do that this year, or we really need to buy cots next year. So that can come out if we decide to use the grant this year and buy the cots this year. We do not have the money in the operating budget to buy it, nor in capital. We didn't put anything in capital for cots, right? We did, but we bought them all. We only did that. We did the remaining 6 at the time.
Right. So we have 10 new cots, but you need 12.
Right now, yeah.
But if we go to 11 ambulances, why do we need 12?
It just, I don't, even through attrition, our highest ambulance, I think, has 140,000 miles on it. So we're still a ways off from decommissioning that. I see what you're saying. I hadn't thought that all the way through.
So could we do 1 cot?
We could do 1 cot.
That is a grant.
And use the
We could
grant?
The grant was 50% of the purchase up to 20,000. So the cot, I want to say they're around 30,000. So we'd still pretty close to maximize the grant and get us fixed long-term for stretchers. So as I think this through, that may be the best thing to do, because we can eliminate it out of the 18 budget by 1 this year and only have to fund it to the tune of roughly $5,000. Now I'll get you the final numbers. I've got a bid from before when we did it. They may need to update it, but I want to say it was right at 30,000 a stretcher.
But would it be the same thing with your stair chairs? It would be 6 1 year and 5 the other, because
Yes.
you would go down to
Correct.
11?
Correct.
So are the stair chairs a lifting device too, or is that something that goes
Yeah,
in the
it's,
house, or?
Yeah, it's the best way to describe it is it looks like it's narrow. It's about the width of these chairs, with industrial style wheels and seat belts. They also have tracks so that when you take patient down the stairs, they're kind of like on tanks, those kind of tracks.
Mm-hmm.
So they they will roll the patient down the stairs. It saves on backs, it saves on the patient getting bumped and you're trying to lift the whole stair chair with the person on it. In the old days, we used to find the sturdiest kitchen chair and wrap a seatbelt around it, and that has since been poo-pooed in the industry. So we have these chairs now, and they're going to be due for replacement, and I put 6 in 18, we could do 5 in 19. I'll be honest with you, if we got to the point of what needs to go and what doesn't, the bottom 3 things you see there, the pediatric system is a way to provide optimal pediatric care in crisis situations, cardiac arrest, very sick kids and what have you. A lot of services have gone to that with high successes. I see that as a priority. The King Vision Airway came from the anesthesia group at CAP, and some of the others are using it. It's a way to put an airway into person's trachea with using an actual monitor so you can see what you're doing rather than the old style scopes that we use. And the child restraint system is to keep kids secured in the ambulance, which right now we have all these car seat rules and seatbelt rules, but we strap kids to stretchers just like we do adults, and that's not safe. And so it's a way to upgrade our system. But the number one thing that we would have of all of these is the radio equipment upgrade, and that's basically having a repeater in our ambulances. We can't talk across the county right now. I was shocked to find that when I came here. We can't even talk across the county, so we could by putting repeaters in our ambulances. That's what most law enforcement and other public safety agencies have to help power up your radios in layman's terms. So I asked Kevin to put together with our vendor the best way to do this, the most cost-effective way to do it. So basically, I was very pleased with the quote at 12 trucks, and we can start looking down the road if we're going to do all 12 or not. But for all the units, it was $37,000, and I'll be honest with you, I think put Bill on the line, but Bill would concur. That's a really good price for that kind of upgrade that we're getting. So that's of all of these, that's the number one priority for us.
Is that through the same network that the sheriff uses, like Moswin, or?
You know, I can't tell you. We're using Moswin right now in our day-to-day operations, and again, part of the reason for that is because we lost connectivity. So we reached out to them. They came and did some training for us, so we converted to theirs, but we still can't talk across the county.
So I guess I'm okay with a lot of this stuff going on to the auditor. I'm not sure that I'm gonna approve the UTV or the transit or even the remounts. I'd really like to look at our fleet a little more. I think we take it in the shorts on buying new ambulances and remounting. I would agree with you fully that I'd rather put a new engine and transmission in the thing and fix it and run it for 1,000,000 miles. I mean,
well, I'll tell you, again, different environment, but we rent them 300,000 in California now. Lots and lots of idle time, lots of idle time. But the last 100,000 was expensive, but we found with a fleet of 70 ambulances, it was still cheaper than remounting. We did one remount there, and I think that's what they do here. That's generally what folks do, is they'll remount one, then buy. So I think with the way we run ambulances here, where we don't have a lot of idle time.
Eggs and bacon.
Punch.
Where we don't have a lot of idle time, and we have some road time, you know, where you're getting the diesels out on the road, and it's not in an urban environment where we're running 20, 30 miles an hour all the time. I think 200 miles an hour, or I'm sorry, 200,000 miles is a pessimistic number. But again, I told the group, let's do baby steps, because I was getting winces and all kinds of looks about carrying them to 200,000. But I think we can do that really reasonably. And I'll get you. I've got a list, and I didn't bring it, but I've got a list of all the ambulances, what their age is and what their mileages are. but,
Yeah, get us that.
yeah.
Okay, we're 45 minutes behind.
Yeah.
So, I mean, so I think we should do the one cot, take advantage of at least a partial
Mhm.
amount of the grant, and buy the one cot. I'd be good with that. I mean, if we're looking at that for capital for the next year.
They gotta know by this year, though.
Yeah, we
Yeah,
got.
by
we actually-
October.
We have to send them a copy of our PO or check to process by the 3rd of October.
Yeah,
Right, that's why I bring it up.
yeah.
So,
So go ahead and buy one cot right now. And
So
take
we're
the
gonna
cots
get-
off.
They're 20 grand each?
They're about 30. I can
So
tell you
we'll only
exactly
get
when I
half
get
of
back
that.
to the
We'll get
office.
15 back.
You're
What's
gonna
it
get,
cost to
yeah,
install?
you're gonna get
Those
half
just-
up to 20. Oh, there's no installations, just the cot.
Okay.
We don't have there's no rail system needed. These
No.
two ambulances we
Those
got this
already
year
in
had the
there,
new
it's
rail
just gonna be
system
put
in.
Okay.
So even if the cot is, at 30,000, we'll get 15 of that back.
you guys good with that?
Debbie's
Yeah.
got it.
Yep.
Yeah,
How much?
if I
About
put that cot,
27,000.
27,000?
I mean,
He may have to
get
update
half
this
of
just
it.
to be on the
Yeah.
safe side, but roughly, we're looking at 15 grand.
Okay.
Got anything else,
yeah,
Jeff?
I'm not- the-
The only thing I have is the schedule he presented this morning, if you guys can try to make a decision by the 1st of September, so that when we get the budget, we can kind of, it's gonna make a big difference in the budget, that revenue amount, whether or not we should include that additional amount or not. So if you guys can make some kind of decision on that fee schedule, so we can plan one way or the other when we go through his budget. Because it will make a difference.
And you'll just take a list of all the ones that you did this year and plug in the new fees in to get your revenue amount?
It's gonna still be against.
Well, it's
I use a
still gonna be-
spreadsheet to come up with, the way it was done in
Close.
previous years was, they did an average amount per trip based on the number of trips and all that stuff, and so it's getting the numbers to plug into that formula in the notes of the revenue, but we can do it, we just need to have
So you just add a % increase based on a % increase of fees, or
a number of transports,
get you close?
yeah.
So right now, he has included that increase in fees. If you're not going to increase them, we need to back it back up.
So then we need to put that on the agenda and we can talk about that? Okay.
Yep.
Okay.
We don't have to decide that right now.
No.
I don't think
No.
so.
But September 1st is not that far away.
Nope.
Nope.
So if we punt it to next week, we can't punt it again. It's like pour it down right now and go.
I can give you one more week,
Go
but
for
after
it.
that.
Oh, the old Cardiac Cardinals, they can
Come on,
score
Mr.
21
Vegas.
points in
It's,
3 minutes.
It's 4th down, go for it.
Yeah.
Well, and
Fake
as far
time.
as capital is concerned, do you want me to put a nice round figure in there that includes everything but the automobile part of this? So it doesn't really change that much from when the
You mean
auditor.
put all of that into capital and
Except for the automobile. So I would put just.
are you
put-
counting UTV as automobile?
Right, to me it is.
I mean, I'm gonna probably tell you, I'm a no on UTV. I don't see a need
Yeah.
for it. We got, the emergency services has one that we can use if necessary, and that's a big chunk, holy cow. I mean,
Yeah.
it's a cool machine, but.
I think with all you're asking, I'm kind of like Jeff.
And on the ambulance, I'd like to get them to where they're basically either have to be remounted or decommissioned. If it costs that much to get them remounted, it makes sense to reduce the fleet by one at that time, and then maybe even wait till the second one is ready to be decommissioned, and then replace it with a transit van at the same cost. You know, you're getting a whole new vehicle at that point, so. I mean, there's a bunch of different ways to do it, Jerry. I think you're on
So
the
we
right
can,
track.
how
here.
how about if we take the UTV out and take the ambulance remount out? We'll do that through attrition. But I really think we don't, if we leave the transit in, we don't have to buy it in January. We can see how the year falls out. Maybe we can leave it in there with an asterisk that I got to come back and give you some data and some information to support the actual purchase. I think that with taking, if we have an ambulance that, let's say we run the wheels off of it, we pick our highest mileage ambulance, we run the wheels off it next year, we decommission it, sell for a couple $1,000s and move on. We reduce our fleet by one. We might want to go that route to continue to help us with the efficiency, because remember, that's pennies on the dollar to run that thing. And we can also, like I said, in backup, in times of backup, we can use that for emergency. It's fully authorized as a paramedic level unit in Missouri. So could we live without it? Yeah, but in terms of planning, maybe just like I said, leave it in there with the understanding that at some point during the year, I'd have to come back and justify it. It's not just well, it's in the budget, we're going to buy it kind of thing. Your call, but.
And just keep in mind, just because we put a dollar figure in there doesn't mean that you are giving any kind of approval for any of this stuff at this point. It's just a placement of money within that budget. Again, this is no approval other than the COP they have to get this year is what I hear. And then when it comes back, he will have another chance in December to make his case to you guys after the budget comes back from the auditor.
In that case, I would really say leave the transit in. Take the UTV out, take the remount out, and leave the rest, and then I'll go back and regroup with our people too, and
Come up with a number, I mean, take the UTV out.
Yeah, you'll have
Leave
all
the 90
data.
for the transit,
Leave-
leave the radio,
Take
take
the
the
radio.
cots out, leave the stair chairs, and maybe some other stuff. You're gonna have about $160,000-$170,000 somewhere in there. I mean, that's just
less than last year.
it's a moving target.
Yeah,
but-
and it's less than last year, so.
Yeah, so,
Okay.
anyway, and then we can talk about.
Yeah.
And I didn't see where you had in the other budget for a motor and a transmission, but.
It was in the notes of,
Okay.
Parts,
Parts
there's about 13,000 extra.
increase? Okay.
Okay.
I think it was 10, roughly
Okay.
10 for the motor and 3 for the transmission.
Okay.
And if we don't use it, we don't use it.
If you don't use
Yeah.
it, you don't use it.
But either put it there or put it in contingency and.
Okay, Sam, keep us going.
Okay, Michael, we're gonna.
I'll try to get you
Okay.
It's the longest 15 minutes of any of these times live.
You
I
have to
know.
move to the end of the time period.
I kinda like it when William Skeepers comes and gets that big book and then we.
If you look at my budget, there really, I have no really large increases. I do have a couple of grants that we no longer have. Alternatives to Detention, it was a $10,000 grant. The drug court is no longer there, but I was able to use dollars from the suspended classroom, which we won't have anymore, but we're changing that particular line item to alternatives to juvenile court. So I do have also within the packet that I gave you, a $10,000 grant that we're going to be adding a line item there. So took 10,000 out where we don't have a grant, but I'm adding 10,000 in there for a new grant. The drug court's coming out on the revenue and the expense side, but it's going to be, those services are going to be picked up out of the suspended classroom grant that we had, and we're going to change that to another name, Alternatives to Juvenile Court, and those will be picked up out of that. That suspended classroom, we will not pay for this year since the school district is picking that cost up themselves, so we don't have to do that, so I redid the services that were being spent for that for other services that we need, such as paying for drug treatment, drug testing, that was part of that drug court grant. Drug court is not really, I have to pay for drug court, but I have to pay for those services within that line item. But as for our increases in our budget, it really has not changed. I did not increase anything within that area. So it's pretty much the same as it was last year as for the grants. But if you look at for the capital, I've got the narrative, and then right behind that narrative as for the cameras, we had them go out and take a look at it. 8,600 for replacing the existing cameras, DVR. But in addition, we would like to have 2 more cameras for the outside for better security. So that would increase it by 954, because I wanted to separate that out, because that is different than what we already have. The the 8,600 is replacing the existing equipment, and the 954 is for 2 additional cameras. Also, we are again requesting, and I've got the backup information behind that, identifying through the Supreme Court for detention facilities needing to have a backup generator when we lose power. The thing we need is the hookups, because we got the generators over it here in the county, which we can use. We're only a mile away.
I thought we did something with that a few years ago.
Huh?
I thought we did something with that.
No, we did not.
did
No.
it.
And you said it was too much.
Yeah.
Oh, so we
It's
did
been like
it twice.
$35,000 to get a pigtail in there, and
Yes.
so.
Okay, that's right.
Right.
Remember.
I'm just saying,
It's a disconnect or something that's so expensive or something.
Yeah.
Yeah,
Something to keep it from backflowing through the,
yeah, I mean, it doesn't seem like it's that hard, but
right.
you just go in there in a box and pull them out.
cut the electric cords.
But I'm just saying, it's there again.
Fired up.
Oh, Lord, yeah.
So,
I remember
okay.
exactly what we were doing.
Okay.
Or not.
I mean, I think we need to do that, I mean,
Yeah.
but, I mean, it's gotta be a
It's a
reasonable
tough one to
price.
swallow.
Yeah.
I don't, this is out of my league here, so I don't know if there can be other folks coming in to take a look at it to see how better we could do that. Because we just
I think
need,
the main thing we need to do on that is get an electrician to see what you have to have operating. You don't have to have everything.
right, no,
Your kitchen, some of your, and it's not that bad. When we did the ESD building, they did it for less than 12,000.
Yeah, I don't know, it was 3-phase or something coming in
Pick
and,
what circuits we
Right.
needed in an emergency, and that was it.
yeah, and that's all we need to do over there.
That's what we
too.
need to do, is how we did with the
That's all you ever need.
building over there, because it was a lot less than that. That's why I think
Yeah.
this was hard to choke down.
right, and I don't know exactly what they were, what was being put in there for the pigtails. It was doing the entire building. We don't need the entire, we just need to be able to function.
Right.
Lights,
Until the,
kitchen, air conditioning,
right,
heat.
right, until it can come back up. That's what we're needing. And then also, the last piece right there is really not capital, but it's a new line item. We got a new grant, and that's just adding a new line item in there. And I've been talking with Debbie and Christian on that. But that's pretty much where we're at.
I'm good.
Yep, we talked about giving you the cameras this
Yes.
year, so, yeah.
Yes.
Okay. I don't know.
Do you need a break?
Christie wants all new furniture and.
No, we've been scrounging. You'd be amazed what we got.
Dump days come, we'll just go trash pile hopping.
No, you better be scrounging, you just got $1 million.
Go get them, Christie.
And Dr. Cameron keeps coming in wanting to
I'm
know.
still pretty excited about that.
We might just shoot you a price for
Okay.
everything.
Good.
I see a lot of reductions, so.
Right, so, the revenues, code enforcement's hard to estimate, we probably should estimate $1,000, it just depends if we have abatements. Immunizations, I didn't put a revenue figure in there, and I should, we want to start, get our contracts with private insurances, so, typically, like, this year, we're right around 13. I would estimate 15, but it could be even more if we get those contracts with private insurances and we start doing more immunizations. So I'll put 15 in there, but it's hard to estimate that. The Ebola preparedness, that 48441, that was one-time money, so we won't have that anymore. If we do have more people that we come in and that we monitor, they will pay us to do that, but it's hard to estimate that. That MFH grant, that's 48554, that's that $20,000 of public health infrastructure money that they, gave every health department in their district, which was like 85 counties in the state. So we have to spend that money by May 31st. There's a list of things that we can spend it on. I would like to spend it on the flooring in the new building that Jim is supposed to be giving me an estimate on. They're removing all those dental chairs, and they'll have all the water lines. So we're going to have to put some sort of flooring down over where they take that out, and that's what I'd love to spend that money on. I just don't know if they'll be out of the building in time. I met with Jeff Davis yesterday, and he said they're waiting on like one more box to be checked by the feds. They have all their bids, they have everything in, they're just waiting for one more approval, and then they'll get started, and they're still estimating,
6 to 10 months. So that $20,000, anyway,
Okay.
it's stressing me out. So the 49860, that was just an error on my part. Like I said, I was trying to finish the budget before I was out on funeral leave, and we do have the grant again for 48,479. So that grant did not go away.
For how much?
48,479, the same amount that we got for 2017. So, same amount.
Oh, okay. Bioterrorism there?
Yes.
Okay.
And then on the revenue, or on the expenditure side, we had taken out the MFH grant because we kind of use that whenever we have grants from MFH, so we took that out, so we'll have to put that $20,000 back in as an expenditure. Other than that, I don't have many changes on the expenditure side. Like I said, that Ebola preparedness was one time.
Your salaries are down. Did you not include any increase there, or?
In my capital request with personnel, I did ask for a nurse practitioner, but we didn't get it added to my salary line. As we talked about with a new building, and actually we could probably do it now, although space would be limited, we would like to add a nurse practitioner that would be able to see sick people, would be able to see county employees, would be able to do those school physicals that we get so many requests for, and it would also take the place of the nurse practitioner that we have that comes in now that does family planning stuff. You know, she just comes in once every other week, but we would have a nurse practitioner that would do basically everything. So.
You get us more information on that.
Yeah, and I gave you a little bit, but if you want more, in my capital request in that email I sent on last Monday, I believe I sent it.
Okay.
See, then our employees could use that, and that could save us
Exactly.
a lot of money.
Exactly. If we do merit increases again, we'll use our tool like we did last year where it's all based on their rating. The only other, like I said, capital request, electronic health record. Our electronic health record, you know, when I first started, they had tried to go with NetSmart, and that was a big disaster. We went back to CGM. Well, it still doesn't do everything we need it to do. It doesn't automatically interface with the state's immunization registry, so our staff have to enter all the immunization records into our electronic health record, and they have to enter into Show Me Vax. It's double data entry. They can't get the interface to work. There's new products out there that are specifically for public health agencies, not for medical clinics, that work a lot better for immunizations. They have barcode scanners, so when we get immunizations in, we can barcode or scan the barcodes, so we don't have to enter in all the lot numbers. It takes a lot of the human error out with the data entry. So we would like to get a new electronic health record. We applied for another MFH grant for the electronic health record. We won't hear till November if we got it. And like I said, we also have that $20,000, but the system that we're looking at is about $35,000 a year. So I am, like I said, I put it in my capital request, but we also applied for a grant for it, and I'm hoping to get the grant. And then with the building, if we need to touch up any paint and do the flooring in the dental areas. And then, I don't know if you remember over in that dental area, they have an area where they have all their equipment sterilizers, and there's already sinks back there. We would like to put a 3-vat sink in there and a stove so we can do cooking classes. We've heard there's a need for cooking classes for certain age groups here in Jeff City that like Hy-Vee can't fulfill. So we would like to be able to use that training area and provide those classes at a fee. So we would like to be able to put a 3-vat sink and a stove in there. And we could also do food safety classes there too if we have the 3-vat sink. So there's a few other items. I mean, we're gonna have new signs. We have a generator at our building. I don't know about moving it. Of course, if our electricity goes out, the main thing we need to make sure is running is the immunization refrigerators. So.
What do you think the revenue would be brought in by a nurse practitioner if we put one in 18?
I have no idea. I mean, it all depends if we decide to charge, a standard fee of just $20 per visit. Of course, we would be able to bill insurance if the clients had insurance, because we are trying to get those contracts set up with private insurance companies. Of course, for our county employees, we had talked about having it be free for them if they were on the insurance, or just free for them, or we could charge them a $10 or $20 fee. So It all depends. I would estimate that they would be able to see at least 4 clients in an hour. So if we had enough, if we had people there waiting, we charged even $20, that's $80 an hour. And then if we build insurance, so, it's very hard to estimate how much.
Well, Community
revenue
Health
could be.
Center, they have a nurse practitioner and a doctor, and I think they're affiliated with one of our hospitals, so I don't know if that's something.
Well, I've talked with one of the physicians at Cap Region that works with their residents, and, they were talking about maybe having one of their residents come over, but then they would do all the billing and we wouldn't, bill for that. So it kind of depends which way we want to go. If we want to work with one of the hospitals to just have one of their residents come over and see clients, but then we wouldn't be able to bill for that.
Yeah.
If we hire the staff ourselves, then we could charge a fee for a visit and we could also bill for it.
I'm just not sure that all the billing troubles are worth the time that it takes to bill. I mean,
Right.
if you're just charging $20 or $30 a visit, forget about the insurance and just charge for the visit. So,
Yeah, it depends.
it's what you're getting. So,
Right.
and it's still pretty reasonable, and it serves the community well. And if you can get in, of course, people don't want to wait.
Right.
So.
It's like casual today.
It just depends.
I like the concept.
I do too.
I would think that it would work, and I would think that we could do it at a reasonable cost. And, everybody that wants to see her would just pay, or him, or whoever it would be. So, anyway, I'm good with Christie's budget. Any questions,
Any
Jeff?
questions?
No.
Okay, and then when I get that estimate from Jim, I'll let you know. I guess.
Papers, I printed some stuff out.
Okay.
Keep on going, Sam.
Huh? We got Melissa next.
I'll just grab some papers.
I have an email. On the
Hey Deb, did you have anything about that tax levy that I could put on?
I gotta go clean up my water.
No drinks in the convention chamber anymore.
You just have-
Still water. I had an email and I just printed out the one for Christie's stuff too, because I didn't have
Oh,
it.
there you go.
So I had printed it out and I had some notes I was gonna put on there.
Okay.
All right.
I know.
You can keep rolling. If I need
Do you
to
have
take a
this?
potty break, I'll just get up there.
Do you have his GIS too,
Yeah.
Jeff? Or did Melissa give us?
Yeah,
that?
she
Melissa gave us
Okay,
that.
all right.
Yes. Yes.
All right.
All right, so mine hasn't changed a whole lot. The main thing that was added was the maintenance on that GeoCortex program that we purchased this year. That will be a yearly item.
Okay.
And I raised my office supplies $100. This was an unusual year for me because all of my print cartridges kind of went out at one time. And so I kind of went over on that. And I can't use those generic cartridges because they mess up my printer.
Fine.
So anyway, and the only other thing, I believe you put that in sales tax, is the hardware upgrades for Midmo. It's the server that we have our SDE, our databases, our website, everything is on, is close to 6 years old. It's going to need to be replaced. So I don't have firm numbers on that yet because the IT person, Jeff Struberg, left the city and they're hiring a new person. They want that person to be in on the planning of what hardware is purchased, so.
Okay.
But I think that's a good estimate.
Great.
So that's it?
Okay.
Thanks.
Okay, see, we're catching up. Okay, who we got after Melissa?
Bill.
Bill,
Yeah.
Bill.
Okay. Not a lot of big changes from last year. I'm projecting about a $90,000 income in several of our grants with the state and the city as well. Our annual $5,000 that we get from Camden County to cover their hazmat response. So that's just about it as far as income. The only increase I put in for was in the hazmat response line, 53203, requesting another $1,000. It puts that line item up to $7,000 a year. I'm seeing a lot of, the equipment's getting older. We're having to do some of this and purchase that ourselves with the grants that they're really getting minimal of what we can replace. Last year we had to replace all the radios. I've got that grant through, which is very, very expensive, but we had to pay for someone to install it. When Kevin Brown resigned last year, that cost us about $4,000 on an install. So the only way I could do that was taking it out of our revenue, which is a pretty big hit if there's something else that might break down. So what we've been able to do with that Camden County $5,000, which has been kind of a blessing, is use that money out of that to help these increased costs of installation. Some of the items that we've had to replace, those was put on the truck 2004, 2005. I'm still able to get that through the grants, through Homeland Security. Every year I apply for that. Again, it's the installation that does not cost, that covers on those grants. So the only other next increase was in my meetings, travels, and dues, $360. Asked that to be returned back to $3,500 that we've had in the previous years. Office supplies, I requested a $100 decrease, just a flat $1,000 instead of $1,100. And other than that, our emergency fund, I put in the $6,000. I think the commission last year put in $2,000, and then we put the money in, I believe, capital maybe outlay on the battery replacements for the sirens, so we need to complete that this year. We did the 7 last year. Next year we need to do the other 7 to get those complete. And that's about it.
So on the expense side, does that 8,800 need to go back into insurance?
Yeah, I didn't know on that.
Okay, I figured
Same
it.
thing if you still want to do a lease for the Shepherd's Building, it's at the bottom of the 54,000.
Okay. Yeah, I think we need to continue that lease payment. And so I don't have a problem paying for the sirens out of capital, but I did make a note here. We did pay for some warning sirens, and
we need to, we need to bill Wardsville for their.
that's what I was
That's what we
going to ask
talked
you.
about that.
I haven't either. I'll do that invoice, because Taos has never came back to me yet. So we did the one we own, which is break time. The other one's not been done.
But I saw, like Loman, did they?
Loman they paid for their own.
But did we replace batteries there, or?
They replaced theirs.
I thought that was on the list. I thought there was
It
several of
was,
them.
but they went ahead, they had done theirs previously, a year before,
Okay.
so it wasn't due.
Okay, we might just check that bill and make sure
Yeah.
that we get everybody billed that we need to bill, so.
So
anyway.
other than that, the only
Okay.
other thing that I just found out this morning, I've been trying to get that number. If you recall, last year we talked about the city and the county doing that project as far as reverse 911.
Mm-hmm.
They did put money into their budget this year to do that. As far as what I got back from Pat McCutcheon earlier finally was $36,000 is what they put in. So half of that cost, if they do it, would be the county. So I don't know if we want to add that on to maybe, if that works this year, put that on to what we pay our annual with the 911 center, roll that in.
I think the sheriff's got that one.
Okay. Well, good. We can just tack it on the sheriff's budget.
He's sleeping over
He gets
there.
everything from me anyway. But anyway, I wanted to let you know that was in their budget. This time they didn't get the pink sheet pulled.
So they got it approved.
As far as they know.
So would our cost be 36,000?
No, it'd be half of that.
18?
I think last year we kind of set aside 16 and then they pulled it out of their budget. So then we just left it. So if that goes, there will be, once they do that, there will be several RFPs put out on it, because there's a lot of those organizations out there. I still like the Smart 911 and the RAID system the best. I think for what we do. Osage County has it, Boone County do 911 system has it, so It'd be kind of nice to be on the same page, if that happens.
So do we want to put a placeholder in there for that? For that reverse 911?
Was that wasn't compatible though with the sheriff's, was it? But there
No,
was
it's a totally
something-
totally different system.
Yeah, there's something that was.
Totally different system.
Hey, Bill, are we still gonna have the Peter Martin contract? You didn't put that in here. You think that's-
You know, they hadn't done hardly nothing this past year, so I haven't seen anything.
Okay.
But the only way they do that, they give us the money first, and then we
Right,
pay it
but
back out
we
of
have
it.
to kind of put a placeholder
Yeah.
in the budget if you think that's still gonna.
Let me,
happen.
I'll be at the SEMA conference, I'll ask them what they're planning on doing on that, and we'll add that, yeah. Other than that, pretty minimal.
So what do we want to do on
Yeah,
that
we can-
reverse 911? Do we want to put,
Kind of put some money aside, and if we don't use it, we'll like last year.
that's emergency services?
That's
I
what it
would
be.
assume.
Yeah.
So could we take half out of
Our part would be 18,000.
each?
And if the bid comes in cheaper, you
Is
still
that what you're
save.
thinking?
Well, that's where we pay for 911 out of.
Right.
Half out of EMS and half out of the sheriff.
Half would be 18,000. 36 total. Reverse 911.
What's the estimate, Bill?
Be a one-time cost?
36,000 is what they put in their budget.
18,000 for us.
18,000 for us, half and half.
Figure it out.
Yeah.
Okay.
Okay.
Okay? Thank you.
Thank you, Bill.
Greg. Greg.
All right, you don't.
Where would you like to start?
You got a big increase in salaries.
Yeah, that's to take into account for a new full-time for the new health building.
Okay.
I hope to have the one HVAC tech filled. I've got 2 interviews this afternoon, so, with two candidates.
Okay.
So hopefully one of them will work.
Okay.
Increasing pretty well majority of the line items, cost, usage, repairs. They're just, I've held it flat for the last 6 years. I've got to take it up. Some of my accounts. Electric, lighting, water and stuff, all are going to hold about steady or have dropped a little bit.
All right, you think materials and supplies are gonna go
Yeah.
up that much for all the buildings?
Yeah, they're going up. We had a cost increase of cleaning supplies this year. The trend has been trending up every year. We're using more toilet paper, hand towels, soap, cleaning supplies, trash bags. Lighting usage is going up. Ballast, plug fixtures, repairs to the air conditioning, heating systems are going up.
So the top portion is all the materials and supplies, right?
Yeah.
And then the bottom portion is?
Repairs.
Is it repairs, or is it the
It's a-
utilities, or?
Which utilities is the?
Yeah, I was kinda looking at, I think it's health here.
Yeah.
53298?
Yeah, that's 53298 is the utilities.
Utilities.
Yeah. I did get some information from Jeff on the building out there. Their first six months of electric, water, and gas was almost $30,000. That doesn't include sewer or the trash. Their repair cost for the first 6 months out there was, of course, they do have a cleaning supply. I asked him to back that out, what they paid for their cleaning. I never got a word, and there was almost $35,000 what they paid for the first 6 months of repairs, supplies for the building and cleaning.
Okay. Any major purchases that you need?
I did put it in there, I had some more floor buffers, got quit. They were vintage 97 models that they purchased from somewhere or were, and there's just a few other equipments that I've listed on the sheets. Hand tools, stuff like that, drills, just little things. So
Is it in here, or is it in the capital request, or?
most of it, I put it in here
Okay.
and made notes of it. Capital request, if you want to do it today, we can go over today, or we can,
I was just looking at equipment that you would need.
yeah. Most of it's, we're starting out to replacing drills and stuff like that. Just
fine, so
I've added
nothing
extra
big.
money, nothing real big.
Even the buffer's not probably that much.
Yeah, new buffer's like 2,600 or something like that, so looking at replacing 3 or 4 of those.
All right, I'm good.
Yep.
Yep. Thank you, sir.
Capital later?
Yep.
All right.
Larry Benz. Here, Larry, I got a certified letter you can have from Conservation where they're not gonna give us gravel anymore.
Not what?
They're not giving us any more rock.
Sure we don't grade them access roads.
I think they put some on public roads if they're not enough gravel. You'll notice it in Osage County more than you do around here.
Sure.
In Osage County, you get some nice white check roads, you can get around, they're wide enough for 1 or 2 horses to pass. You know there's conservation area. If it's a go path, it's not there. Let's go for a road trip, Sam, I'll show you that.
Yeah, we gotta do that
You
this
guys want to start with 211?
fall when the weather's.
Break some bail money, you never know about that. Being in Osage County, you can meet sheriff.
I met him. John brought him
Okay,
in
you
the other
better
day.
go.
Yeah,
I was doing pretty good.
I know.
Come in, Larry. Just going down through, I'll just kind of hit some of the highlights. On the revenue side, you'll notice that we're not going to surplus anything. We're actually going to sell it or trade it in when we purchase equipment. I'll get to that later on. Salaries, I actually put 2 and 2 in the budget. The reason it doesn't show 4 on the end is because we had the 2 retires last year. They were large salaried employees that we replaced. Just nothing real.
Why is there such a big increase in loggers there associated? I mean, he's got a $40,000 increase in salaries and a $50,000 increase in loggers.
I gave him the figure for loggers and surf together.
Uh-huh.
Most of his people are ones that have been here a long time, so we don't have to pay the surf on them.
Uh-huh.
So we'll reduce that to what it actually.
He just did it based on each employee total.
Yeah,
Where
that's-
some of his employees, we don't pay the 4% for service, so we'll go in and adjust it to actually.
Is that awful high, or?
His estimate's high because he did it for every.
I did it for everybody.
Okay, that's fine.
And I
I just,
said- I
it just looked out of line.
Yeah,
So,
in the past, we'd calculated like what they said, and Deb said just use 11.4, so that's what we did, so.
As they get new ones, that will be the total.
Yeah.
Yeah, it will go up as we replace the older employees.
so when you increase your salary line by, and I'm just trying to get this, so you increase your salaries by $40,000, you're gonna increase your loggers by
No,
50,000?
His 2 people that retired this
Uh-huh.
year, we weren't paying CERT on, we weren't paying 4% because they were long-term employees that
Right.
were here prior to the date. When he added 2 people, even at the lesser salaries, we now started paying 4% for CERT for them. So as he gets rid of his long-term employees and they retire and he replaces them, we
Mhm.
will start paying 4% to CERT for those employees. Right now, his older employees, our grandfather did with CERT, and we're not paying 4% for them.
Right.
It's-
But I mean, so I'm just trying to understand, so you added 2 new people and you're paying surf on them and it's 4% per person, right?
Yes.
And so you got a $30,000 salary times 2, so it's $60,000 times 8%, so.
What I told him was to take both surf and loggers, add them together, times it by his whole salary line.
Yeah.
So that's why it's so high.
Yeah, it'll roll back.
So
So-
the increase for next year is not that large, but as he replaces those people, he will eventually get to the figure he has in here.
Yes.
Because once we get to the point where we're paying surf on everyone, he calculated it with surf on everyone.
So what is it? What's it close to? I mean, 8% of $60,000 isn't that much. I mean, it's only on the new people, right?
No, it's on the old people. The
Why?
4%. It won't be on there when we get to the.
It's
final.
only on the new people that are coming in that we would pay the 4%
So
on,
the
because the
increase
old
for
people.
next year is not this large. The
Right.
number he has in here is where we will be eventually once everyone is in service.
Since 2002, anybody hired
I
after
get that.
2002. So eventually, we'll be paying that kind of money countywide, not just his department. So we'll be paying that kind of 11 point whatever % on everybody. A lot of his people, we don't have to pay the 4, but in his figure, he put 4 on everybody, because I told him to, just for a round figure. I didn't know it would amount to that much difference, but he does have a lot of longevity people.
But everybody but 2, the figure's already in the 17 budget.
No, I don't
Right.
think so.
When he did his estimate though, he did it on everyone.
Right.
That's the difference. The 50,000 is him doing it on.
4% on top of the
on
4% that they already had in the 17 budget.
So there's more
Right.
than just 2 people we're currently not paying it on. Probably half of his employees.
Or more.
Or more are not covered under, are not being paid 4%.
But until we replace them, we
Right.
won't pay that,
That's correct, that's correct.
right? So
But
if it's,
that's why his figure's off, is because he included 4%.
so if it's
for everyone.
10% on 60,000 in salary, it's $6,000.
But that 17 numbers that they had, already had the surf numbers in it, and then he added to it.
Right.
So the
that's where
17
the
number
big
is only on the
increase,
people
I
that
think,
are
right?
currently in service.
Okay.
He included it on everyone in these.
And we're not gonna
It's
let
all
you
right.
guys
We're not gonna
retire.
let
So,
them
I mean,
have
we're
that.
just
We're
gonna
gonna base
keep
it on that.
keep everybody.
He doesn't use
Well,
it.
it goes back in our contingency, so we don't care.
Yeah.
Yes, it will.
It's confusing, so wait.
Sorry, that-
Okay, then. There you go.
Hi, Larry.
Any big ticket items, they're relatively small, or percentage-wise, there's a couple of them, like office supplies, no, surveying supplies went up. We added $500 more, that's just because we've got a SIM card now on that, for that GPS mapping device that we purchased, so they're relatively small. They show up percentage-wise large, but probably the biggest ticket item, the fuel, it shows 12,000 more, but again, that's kind of a shot in the dark. I use the EIA information that the feds put out as far as projections for the rest of this year and next year. That usually comes in quite a bit less. Parts, we increased $30,000 on that, but we reduced repairs by $30,000, the same amount. We're doing more in-house. So blades, we took down 5,000. We're not using this quite as many the last couple of years. Culverts, we increased 15,000. It's like everything else. The stormwater issues are just a growing figure. Joe and his crew tend to keep ahead, are doing a good job of getting them replaced more frequently. We did include additional 5,000 in concrete as far as repairs that we do in-house. Vehicle and heavy equipment, we increased that. We're proposing to buy a new single axle truck, a new 550, and a new boom mower next year. That's $396 is what it comes in at. Highway maintenance facility, we increased that a little bit. We're looking at putting a new roof on our lean-to up here on the hill where we store a lot of equipment. Other than that, that's road.
Leased equipment.
Do what?
The leased equipment.
On the leased equipment, we took down
30 grand.
Yeah. And what it is, we're looking at, or working to purchase a new loader this year. So we'd be able to put the new loader up at Centertown, and we'd still rent one, a larger one, for a shorter period of time. It'd be basically probably about December or November to March, something like that. We purchased the excavator we used to lease, so we feel that we can take that down. Any questions on road and bridge? Otherwise, we'll move on to another one.
You think that leased equipment will come down more than that too?
Yeah, we think, but
know how
that's
much
where we
other
come in,
stuff,
that's
right.
where we lease skid steers and stuff as
Right.
needed, many if we needed, you know, as well as air compressors, stuff like that. We think that'll come down, but we'd like, I think, to coin Jerry's phrase, do it in baby steps.
All right. That boom mower and heavy equipment, I mean, we've got two, right?
Four.
We've got
four.
Yeah.
We replaced one just a few years ago, didn't we?
Yeah, last year.
So,
Or year before.
Year before.
the others are wearing out too.
Yeah. We're getting, I think it's got like, I don't know if it's 7,000 or 9,000 on that one now.
Hours?
It's probably close to 11.
11. So it's, you know, the operators we've got in them now are taking care of them. We're getting, you know, most of the time tractors, if you get 7,000, you're doing good without some major problems. But the operators are taking care of their equipment, so. Any other questions on that?
Where was the leased equipment at?
It was towards the top there.
On page 2.
Second page, top,
Oh,
yeah,
okay.
30,000.
Okay. I
We-
was still trying to track it down.
We
Saw
had-
the other 30,000 of me.
We had
Okay.
leased an excavator and that
Yeah.
loader, and then we got rid of leasing the
I didn't go
excavator.
back far enough.
So we bought it.
And as far as loader, in the past, we've kept it pretty well year-round until we got the dome filled back up. But once now, with this new one, we can bring it back from Centertown and use it. So hopefully it'll shorten that up quite a bit.
Okay.
Okay, next. let's
Parks.
look- Parks, or you wanna do, I was gonna keep parks to the end.
That's fine.
Okay.
What do you want to do next? Planning?
Let's do planning.
Okay.
There's not a whole lot there. Again, planning, income side, we're taking that down just a little bit. Well, no, I take that back, I'm on the wrong one, I got Eugene.
I'm good with planning, Larry.
Okay.
So, anyway,
That's good.
I don't know, you guys got any questions? I mean, he's got a salary increase and some associated
Put two
stuff
and two in there, same as I
Yeah.
did the other one.
But your revenue's up a little too, so.
You think permits are gonna go up that much?
That's, right now, we're getting permits in, we're being optimistic, but we're getting permits a lot quicker pace than we were last year.
Okay, what next?
Eugene Water.
Sell.
Yeah.
Giveaway.
Giveaway.
Yeah, no, heck with selling, we won't give it away. We might even pass a hat and put some boot in it. One thing,
I might put money in just to give it to someone else.
we do have somebody that may be interested in it, but, next year what we're proposing to do is to install a fence around the water tower, security fence, as well as, try and paint the tower. Once we get those two items done, with your all's permission, I would like to contact Missouri Rural Water and see if there's some way we can put this out for interest to take over. Like I said, there's one local individual that may be interested in it. He wanted to take over the operation on, we did the billing, we said no way, so. So,
They can pay somebody else to do that.
yeah.
And those upgrades were based off of DNR when they did our inspections.
One thing we need to look at real seriously, we discussed it a little bit last year, we're continuing to lose money every year on this operation. We need to look at doing a price increase. So, if that's something we agree to.
Well, it's been a couple of years since we've raised that, isn't it?
We haven't raised it, I don't think, since we.
We had to raise somewhere in there.
When we took it, when we took it over, we raised it, yes.
From the trustees when they took it over.
Yeah, but we haven't raised it since then. But we're consistently losing roughly 10,000 a year. And we're still making the payments, that's the 667 to pay the county back for the original.
No, it needs to pay for itself.
Huh?
It needs to pay for itself.
Well, it's going down. It's slowly, as we're getting these hits from DNR where we've got to make changes or improvements, it needs to be raised, whether we do it or if we can give it to somebody else. So.
Is that the increments on it, Debbie?
Yes.
Okay.
That's something we need to put some emphasis on.
Can we get some costs on what other districts are charging for water usage so that we could do some comparison and look at that?
We can.
I mean, obviously, our costs are associated with what our costs are, so.
Yeah.
That's gonna be more too, because they have fewer people on it.
Right.
And it's just,
We actually lost a few customers this last year, so.
the other option is it closes down and they gotta figure out something else for water. So,
I'm not sure if DNR would let us do that, but,
so they're gonna let us do it to continue serving at a loss.
well,
Sure they would.
I don't think they can.
Yeah, we can't operate at a loss.
well, maybe
It
they
doesn't-
could use that $3,000 we had to pay for our
Permits.
Permit for, yeah. It went from $300 to $3,000 this year, so.
Okay.
Next, sales tax. Basically, what we're looking at doing, probably the one of interest is joint projects. I think the city is proposing to have High Street ready to take construction next year. We've included money in there for that. We've also included money in our budget for the Algoa Railroad Spur to run to the plant. We've got in there, with the sales tax, we do have $290,000 for equipment that's set aside for us. We're proposing to purchase a new grader, and it'll be back on the buyback system to where we could start rotating them out like we used to have. We've got currently 2 of them on the buyback now. We'd like to get a third one back on it, so.
If you guys are looking at those papers, the first part of that is the old sales tax.
Right.
Which they're intending to close that, and so that's why it looks a little funny all in red. But if
Right.
you go back to the second page, you can see that, what he's talking about in 805.
805.
Yeah.
Okay. 290 on the equipment, okay.
Yeah.
So depending on where the projects in 803 end up at the end of the year, there could still be projects open in 803.
Okay.
Yeah, there will be.
Those will all be closed out, and then we'll just be working in 805.
Right, once all the projects are completed, yes.
Okay.
As far as other projects that we're looking at starting next year, we're doing a design contract for Business 50 West. We'd also be doing construction, hopefully on Waterford Road, gravel road upgrade. That'll continue the paved portion down to Mount Hope and then back out to Route U. We'd start design on Lesh Road. We're also looking at doing a bridge replacement on Old Forge. Down there, we had it went down the, what was it, 6-ton now? 6-ton load limit this summer from our inspection. We'd still be working on the crossroads out here by our shop, as well as looking at starting Meadowbrook Estates in there, getting that started next year too.
So the bridge construction is for that old Ford Road?
Yeah.
That's the one that we,
They're gonna use BRO funds on?
Yes, that'd be BRO funds, it'd be 80/20.
80% us, 20% them?
Right.
I drove that one, and I think that road ought to be shut down or something else done. I'm not gonna spend $220,000 on putting a bridge there. Doesn't serve anybody, really. it's a crossing for few people that run tractors through there, but anyway, it's, I don't know. I think we ought to talk about it, so.
Yeah, I'm not familiar where you're at with that one.
But you ought to take a drive out there. Comes off of, what is that, West Brazito Road there, and, I mean, it's a little bit of a cut through, but.
It's cut through that,
There's a 90-degree turn in there, and it comes in, and I bet there's not, I'd like to see what the traffic count is on that.
do a traffic count on it for you.
Okay.
But I bet it's not 50 cars a day.
12.
Yeah.
If it's 50, they're going to paved.
Yeah, it's the same guy running back and forth with his tractor.
Could very well be. I mean, you're not gonna close it down, you're just not gonna spend the money to put a new bridge in, right?
Yeah, I mean, some little box with some culverts or something across it would be, I think, plenty. Low water crossing. Not going backwards, it's just,
I have some of those on my
probably a farm road that somebody put a concrete structure in there and we got it.
Yeah, that's why we don't take them over anymore.
Anyway,
Okay.
I think that's in Jeff's district anyway.
I didn't think I had any gravel roads on my side. Never agreed district, and now I got a bunch of them. Aren't you in Russellville?
No, I'm not in the
You're
city.
outside of city limits? We'll have to get you annexed, so I don't have to worry about you.
And she lives,
Or say-
Yeah.
she's like me, we've moved out far enough to where we can't be annexed.
All right,
Okay.
sorry, where were we?
Sorry.
Where were we?
Done with sales tax, weren't we?
Sorry.
Yep,
Can't
Now the-
afford it anymore.
best for last.
Awesome.
Parks, what we did, you know, we've come to you for a person, additional, or a person to be assigned to parks. What we did this year is we actually went back and looked at the funds that have been spent over the last 2 years as far as equipment hours and time, or personnel time. And what we feel that if we're gonna still use Road and Bridge to accurately reflect the funds being spent out there, we need to increase the reimbursable personal services of about $32,500, and its park improvements to 18,800. And the way we did that is we went back and reviewed. We added up the equipment time. We used FEMA rates as far as Road and Bridge equipment that was used out there, as well as our salaries with benefits, and that's pretty well the average of the last 2 years
Yeah,
that we've got.
16 and 17.
Yeah, 16 and 17. Whether we do as much as in park improvements, you know, that's up to you all. The maintenance, the reimbursable personal services, that was just maintenance costs, you know, cutting grass, doing grading out there as far as, you know, the parking lots, trimming the trees, you know, but somehow we need to get, you know, right now Road and Bridge is subsidizing the parks. We need to get that number to more accurately reflect the true costs. And we've got 4 parks if you count Ren's Lake. You know, we've got.
Sorry. No, I'm laughing too.
Well, we still cut grass out there.
But that's not included in here, right?
Yes, there.
No, it's not.
No,
Oh, that's not? Okay.
The cost for Ren's Lake and some of the other properties that we have isn't included in this cost.
Chris had asked us, we put these numbers together, and he actually came out and reviewed them with us here, I guess it was last week. Just to take a look, you know, whether we get a person, you know, that we can put out there full-time, or if we're gonna continue the way we're going, we need to somehow get those 2 line items increased to more like I said, to fund the parks the way they should be funded, instead of road and bridge.
Now, we've, in the past, we've transferred, what, 10,000 out of general revenue?
18.
Huh?
18,000.
18,000?
Yeah.
And then sales tax generates, what, 20,000 a year for
We do have-
improvements and stuff,
Yeah,
right?
we do have had money in in this capital sales tax.
Yeah, I was gonna say we added 10,000, yeah, in capital.
And we are running that grant through there too.
Yeah, the grant will basically, that we got for Brooks Park for the playground equipment as well as our time and equipment and materials to build a walking trail out there. We're running that through there. We'll actually charge, any time and materials from road and bridge to that. So, it should be a wash money-wise there.
How many hours of your people's time? I mean, is it more feasible to do a full-time person in parks, or is one person not gonna cover the total number of hours?
At times, Kristen, I think you're gonna need to supplement that. One person can't do some of the things, like the, trimming the trees or doing a work on the pavilion where one person can't do it necessarily by himself. We've got the hours, we can get that information to you. We can add the hours up and send it to you, so. We've got it in spreadsheets, we can send you all that. In fact, it may be I thought Joyce was gonna try and attach that to the.
It should be attached to your budget.
You should have the information with it, so.
Seemed like it was about 12 or 1,300 hours was used or something
Yeah,
about that.
I don't remember the number.
So it wasn't full-time hours.
1,244 last year, and that's 761 this year, and that's
That was-
only half the year.
Right.
Yeah, that was up to end of July. We had 761 this year, and that's just the maintenance side, that's not, or was that everything?
That's everything there.
That's in doing them park improvements too?
Yeah.
Okay. And again, if you look at going with a full-time employee, again, we offer to pay out of Road and Bridge the salary during November to March or something like that, because we could definitely use the person in a snowplow. Because right now we're running. Yeah. Right now we're using our grader operators in snowplows, unless the storm gets bad, and then we'll put them back in their graders and we'll hire part-time, bring in snowplow. So, any questions?
Nope. Thank you.
Same old story, just repeat.
I go by County Park a lot more now because my mother-in-law's at Primrose. That really is a nice park.
I'm not so sure you shouldn't include what time you spend on Friends or some other spots that we do have in it.
They've got that, I think they've got the numbers on that, it's just not included in
not
parks.
included in this.
In parks.
Yeah.
While you're talking to Public Works in reference to budget, I was gonna ask, are we still looking at the central maintenance idea? Is that something that we can have a separate meeting on that later? I know that Jerry and I both have expressed interest in that, and I know that Larry asked, so I didn't know if there was a way if we can need to have an offline conversation on that.
Yeah, it's something that we've definitely talked about and we're exploring and trying to come up with a master plan for out there to possibly do central maintenance, so.
We've looked at two different things, a quick fix that we could possibly start doing it fairly quickly versus a master plan is what the county wants to do with the whole property. Our building currently we're in right now is building 84. I'm not sure how long. We've tried repairing it. We put a new roof on it last year. There's some issues there. And that's what we're trying to look at, what we want to do. Trying to give some kind of plan overall, whether we turn that into central maintenance and move the offices to a separate building, that type of deal. We'd like to put in a car wash, pave the parking lots.
Paving partners, the car wash would be nice, ones that don't knock our decals off, that would be good.
Well, we gotta have the higher stuff.
I understand.
We haven't put a switch on it for you all.
Yeah, but we're definitely looking at that. I think it's, you know, with the issues that you've had this year, you know, it's, I mean, oil changes are one thing, but, you know, fixing stuff is a whole different ballgame.
Tires, I mean, it's something that's it's gonna be all encompassing, and I appreciate what Larry just said about the fast fix, but I'm more interested in the long term, and knowing that we have something laid ahead. I mean, I'm willing to use some of the law enforcement sales tax money on that if need be, because I think it's that important. But I really do want to start moving that direction.
I think it's important that we look at the whole county as far as, you know, being able to have racks that will lift an ambulance or
Well,
a dump
just
truck
worry
or.
about me, so.
I know. But you have pickup trucks and you have cars, they have
Okay.
trucks, they have
All right.
trucks, you
We
know.
can include them too.
Light trucks, so it'd be multifunctional, and I think it'd be,
Well, we're gonna have to have something that'll pick up the Brinks truck, so it's gonna, I mean,
if
you're
it picks
right.
up a dump truck, it'll pick up
Yeah.
your Brinks truck, so, maybe. Depends on how much steel you put on it.
But anyway.
But you're gonna have to keep it light enough to keep your tires from going flat.
Yeah. You know, the other thing I wanted to bring up before you went into the closed session.
Solid.
No, we still got Brian, and
Oh,
we still
yeah,
got
sorry.
Donnie, and we still got
Okay.
I'll
Debbie.
wait.
Okay, guys, thank you. You're welcome. Larry Square. See ya.
We're almost on schedule, we're
Run
10
before
minutes,
he asks you to
we're
take
10
over
minutes
Hamel.
behind right now, this is
That's what I thought was coming.
Mine's about animal control. Hey,
Thank you.
Yeah, we're catching up.
I didn't see anything on animal control.
Thank you.
7 years from now.
7 years. Wait a minute.
Okay, I guess the first thing I need to go over is evidently I messed up the salary part because it factored, I guess I was just going by what it recommended, and which I thought was real generous for me. But anyway, but it must have factored in like
They told you how I vote around here?
Dale's. Yeah. So anyway, so I think that needs to be reworked. So they'll-
It included Dale's payout.
Yeah.
To show that the actual number included.
That's fine, we can adjust that. That's simple.
Yeah, and then so you'll find like on the spreadsheet that I gave you on the first page, really the major change is that I added a line item on an annual basis for, at the very bottom, it says HA, email security business, and what that is, that's the business continuity software. So we had an email outage earlier, and this would prevent that from ever happening again. So that would literally be something that we pay on an annual basis that should, something happen with the email server, everybody would still have access to their email. So, and it also does some other things too, like filtering and things like that. So I've got some more documentation on it, but that's a recommendation to put in the budget. That's an add-on.
So like the 4 days when our server was down.
Right.
If we had this,
You wouldn't have had an outage at all.
I kind of enjoyed it.
Okay.
Yeah.
That was your equipment.
had to make phone calls again.
I'm sorry?
That was added to your equipment service contract?
Yeah.
It was added to the, yeah, I guess that's what yeah. So this is my first time doing this, so I'm trying to make it through it. So, other than that, I think, I noticed that the fire alarm stuff wasn't put in there from last time, so I stuck it in there, and that's an additional $480 a year. And then there were some servers that were left off for some reason that I plugged back in there. But other than that, everything else was pretty much status quo. I went through and I checked with the different department heads and elected officials, and they gave me recommendations for any type of maintenance increases they saw coming down the road as well. So I tried to cover that.
What was the $8,400 increase for internet?
Okay, so what that is that, are you looking at, What page?
I'm looking at Debbie's sheet, actually, I don't know. If
Oh,
you
okay,
have
sorry about that. So-
$28,400 is what you requested for the
Yeah, so
internet.
that's pretty much the sheriff's fault. Just So anyway, so what we were looking at was, we needed a better internet connection over to, at the sheriff's office. Right now, they're running on a 5 meg connection. So I went ahead and factored that into my budget because I really didn't know how we would work that out. So that actually is right at $200 a month. So that's $2,400. Then also, I was asked to check into, at some point, relocating the main communication gear from the courthouse over to the sheriff's office. So less the build out or anything, I got a ballpark figure from CenturyLink at $1,000 a month. So what I figured was there's going to be some carryover between the cutoff because the general idea is that there won't be an outage. So I have to kind of run those circuits parallel until we get everything cut over fully. So and I'll do that like a department at a time. So I factored in about a 6-month layover, but I don't think it'll be that much, but I want to give myself a little bit of breathing room there to make sure that all that can happen. So I factored that in more towards the second half of next year. And so that's the additional $6,000 that came in. Like I said, I don't know how that's all going to work with the sheriff or anything. I hear he's a really giving guy, so. So anyway, I went ahead and put that in there for that, so.
So the $6,000 is kind of a one-time cost.
Right.
In that transition period, and the $2,400 would be an ongoing yearly cost.
Correct. Yeah. So what I'm thinking is that none of this stuff will happen as fast as what it should. But what I'm thinking is during the interim, the sheriff's office is literally running off of an internet speed most people have much better in their houses. And he's running his entire department off of that. So what we could do is for that year of period where he needs that data, we could do that. And then once we get the circuits cut over, it's very possible we could do without that.
So is this just kind of moving the hardware type stuff over there, and then you would stay where you were at, or?
No, as far as I know, I would be moving over there too. So the sheriff has graciously offered to look into doing a build out for me for a particular area in his department.
Okay.
Then we can get rid of the generator and that big
Right.
tank. And,
Yeah, this is all
and,
kind of, predicating that, and
Yeah.
so.
Okay.
So.
What was their capital amount last year, Debbie?
Over 200 something. I'll go check it too.
So you've got the 149 and then another 155?
Right.
So you're at 305, somewhere in there?
Right.
We had budgeted 233,000.
So, do you have any other questions on, now, just to let you know too, it's really difficult to, as far as to project when these things, like some of these amounts are actually gonna fall off too as well, because if we go over to page 2, we're due for server upgrades and workstation upgrades. So right now, we're supporting just for the county, not Public Works and not prosecuting attorney and not the recorder's office. We're supporting about 12 to 14 servers. So on page 2 there, you'll notice that I've put a line item in there for virtual servers, which is pretty much the major difference to the budget for this coming year. So, I've gotten a pretty good, I think it's a pretty good figure for about 85,000 for 2 units, but they'll support up to 12 to 14 servers. So I'm cutting back on other hardware basically I'm bringing my amount of devices down, but I'm keeping my servers up to the number we have now. And then And then also, too, a lot of that's predicated on the end of life for Windows 2008 being projected at January 2020, and also Windows 7. So I put in a line item in there for workstations. So I have roughly 80 workstations to upgrade over the next 2 years. So I thought I would do 40 and 40 over the next 2, and then I've got another 40 out there, and we'll put them on about I'm going to try to make it on a 5-year rotation. So so with the technology I'm putting into those machines, that's very doable. And then 5 years is pretty much an end of life on a hardware maintenance too as well. So then something else that's big that's not happening right now is the remote monitoring software. So the big challenge to an IT department is being able to monitor remotely all the different workstations and servers that are going on. So there's roughly about 22 servers, and there's probably around, if you look at page 3, 297 total computing devices. So right now, I spend some of my time running to different departments, trying to get those things taken care of, the ones that I support. So what this would allow us to do is, right now there's really no proactive management when it comes to making sure all the patches are installed and all those things like that. So what this does is that allows me to remotely connect to any computer at any time. It allows me to monitor the patches and the different security patches and things like that, and just provide overall, maintenance on the network fleet. So anyway, so last year it looked like to me that the emphasis was placed on upgrading the switches and things like that, which is still happening. But this year over the next 2 years, it's going to have to be getting ready for that end of life on those particular servers and things like that. So anyway, and then the other big item on there is the Exchange upgrade. So right now, the county is running on an unsupported version of Microsoft Exchange, which is the email. So like, for instance, when it breaks, I can't, Microsoft doesn't even want to help support it anymore. So right now, we're working on getting a couple of different bids for doing what's called a migration that takes us from our old mail server to a more current one. So that's on there as well. So there's some big bites on there, but it's stuff that's been looming out there for quite a while. It's just it needs to happen sooner rather than later now. So, and then I went ahead for the new health department. They're going to have new wireless access points out there that's going to give them coverage site-wide. So I went ahead and factored in 6 of those for those areas out there. And then just some general monitor upgrades along the way. So
the virtual servers, is that just kind of one-time cost?
It is. Yeah, it's a one-time cost.
And what's the life interval of those?
Probably 5 to 7 years. So anyway, a lot of it too depends upon the amount of resources that as the county grows and does business, as far as making those things scalability. So it says servers, but really you're looking at storage and all kinds of things like that. So anyway, another thing too, what this allows us to do is when you virtualize servers, the cut down version of it is you can have snapshots. So if something should happen to a server, I can actually have it back up and running just by simply turning on, the previous version of it, like whether it's like 10 minutes ago or 15 minutes, whatever intervals that I set it to go through and have it do that. The reason why there's 2 there is because you have what's called a failover. So if one server completely goes down, that's running 12 servers, the other one picks back up and nobody ever notices it. And that's why I would make sure I have the hardware maintenance on it as well. So there's a lot of moving pieces and parts in the county network and things like that. And I really didn't even address the phone system for a while. So yeah. So but email is big. I mean, emails, when it's not working,
Alec,
it's not a good time.
Okay. I don't think I have any questions.
No, a lot of information to chew on.
Nope.
Oh, yeah.
For
Okay.
a
thanks,
new guy,
Brian.
you're doing okay.
Just okay?
Yeah. Okay, Donnie, we're only 10 minutes behind.
There's only two places in the budget that actually went up, and that's on the part-time, my personal services, that's for guys that work for me for extra court duty here. I raised it up this year when I talked to Kristen. Christine, I had to ask for more money this year. I don't see anything changing in next year's, the way things are going right now after talking to public defender. And I've been using some of Richard's guys to fill in when I need just an hour, 2 or 3 hours here without calling somebody else in. Kristen said Richard's been bringing in about $400 a month due to the pre-release shackle program. Now on the bottom you see a $7,000 increase. That's mostly what that is. Right now he's supervising 65. I think you've backfilled almost all those spots with other prisoners that coming in, paying prisoners coming in. But right now we still got about 10 or 15 in the jail population that are not represented by an attorney, and we're going to try to use those on leg shackles if we can. That the public defender doesn't know when he's going to get back to full steam where he can pick these people up. That's really the only things I've changed on here. I added 500 in the miscellaneous. That's mostly because I have 5 or 6 more employees than I had before.
What's the increase in the expense, supplies, pretrial release program? Is that shackles or?
That's the shackle.
Okay.
Because I foresee, like, if not represented, if they interview them, they look like they could probably get out and they do have a job and they can pay for it themselves, let them pay for it themselves. But if we can put them on a shackle and put them on GPS and they're non-violent, we might be able to get them out until they can get another attorney. If they post a bond, anything above a $5,000 bond, the public defender won't take them anyway.
Where's that revenue come in at for the people that are on shackles?
Right at the top.
Very top. It actually started about 3 months ago or 4 months ago when he started getting more money.
Started in April and we brought 400 in the last couple of months.
Okay.
But we don't have a lot of history there yet.
Okay. This is since we started with this new company or
Yeah.
whatever, and then we're doing the billing or whatever, and okay.
And then the extra part too on the part-time up there is that the Richards grow up to 16 hours a week to 20. They're still filling out the paperwork in court for their emails and for their telephone numbers. Out of the 12 last law day we had, he said issuing warrants on 12 of them, she only had issued warrants on 6 because that girl actually ran them down and got a hold of them, got them come back in. So he doesn't have to reprocess them in the jail. And on the one piece there for my professional services, that's getting bid out now, and I really don't know what that's going to be. I have ran it over with John a couple times about maybe hiring, giving the money to them and letting them hire people, but we kind of got a shock on, after talking to Kristen, what it would cost compared to bidding it out. It's about $50,000 more a year, and it's, so if we use them.
Do we have a breakdown on this in BSNA or whatever of what's court martials versus pretrial release?
We have a spreadsheet that we could do.
Okay. 'Cause I mean, obviously you have, Sparky and
Yeah.
your bailiffs in here, but then we have Richard and
Yeah.
some of your others that
So
are
their
kind
salaries mixed in, but
Right.
that's one line item,
Yeah.
and the rest of them are.
Right. Right.
I put more hours in for Gary and for Jess is what I did this year.
Right.
And then the 4 hours per week on the other girl. We're getting ready at the end of this month, we're gonna start taking on Judge Green's court. We're just going one court at a time until we get it completely right. And then Soderman's will be the last bunch.
Okay. Sounds good.
Anything else?
Nope. You're good. Thanks,
Thank
Donnie.
God, we're back on schedule. Okay, Debbie.
Okay.
We're gonna do,
You can have that.
Let John go, or?
We
John's-
got our budgets, if you guys want to look at those, or if you've already looked at those, the ones that you guys have to submit to the auditor. It's up to you, I mean, there is not much difference in the commission's budget that,
Do you just have something real quick, John, you want to talk about?
It was just that what you and I talked about yesterday.
I didn't know.
That's fine.
Him up here.
I mean, I can wait.
No.
I've been patient.
What?
Let's let the sheriff go and we'll come back
Okay.
to ours.
I'm trying to get rid of it.
Okay.
No.
So, no, it's just something that Jeff and I brought up. You know, one of the things that I brought up whenever I ran and when I got in, it was a program, PT test for physical fitness, right? I can't make it mandatory. If I make it mandatory, then I have to allow my people to, while on duty, to go work out, and I simply don't have enough personnel for that. However, I can do a voluntary, but then give them some time off of work if they're at the upper percentile of what we determine to be the best. So, but moving forward on that, I need to get some equipment, and I did not realize how expensive some of this equipment is. So what I was thinking about doing, and I brought it up to Jeff about putting it in my capital improvements, to put $20,000 in there just for some of this equipment to put in. That's installation also. If we could put it in one of the bottom part of our facility, and it would allow our guys to come in at any time when we're not having training, because we do have mats down there now, and we do provide training down there. If there's no training going on, then they would be able to work out on their own. Jeff brought up a good idea about just paying for their membership to a physical fitness. The problem is, that's an ongoing cost that we're going to have to pay every year, versus this is a one-time cost that I would have to pay. And then there's no way to track if I pay somebody, let's say John Wheeler, to go to the gym and work out. I don't know if he's actually going, so that may be a waste of money to pay that. So there's good and bad on there, but it's something that we have to look at if we're going to address, especially with the atmosphere right now for law enforcement. You know, we've increased our training this year. You're going to see in our budget we've increased our training more because we got to get all of our people better suited to defend themselves and the citizens of Cole County. So I'm not looking for any answers. I'm just wanting you to think about it and then give me any kind of input you can think about. And if you want me to come back at a later time, I can. But it's just something that I think we need to think about and pushing forward with the professional capacity of the Cole County Sheriff's Department.
Does JCPD have a exercise?
Yes, they have their own workout. But it's the same thing. I mean, I even thought about going to them, but truthfully, they have enough people that they can't afford all of us to go to their workout. And then you have to worry about a secure facility, like mine's a secure facility, about who you're going to let in and who you can't. And then
No, I was just wondering if.
Yeah. No, they do have one. Matter of fact, they just redid theirs, so. So it's something that we really need to look at. It's for the betterment of Cole County, for the betterment of workers' comp claims. I mean, it's better all the way around.
What was the cost again?
Well, we had just came, yeah, and we're looking at a cable crossover. That's the most efficient. One of the most efficient things you're going to be doing is a cable cross, and that's a very expensive item.
And he's not looking at new stuff.
No, not right now. I'm not. So we actually found all of the equipment that we need for $11,000, but Kristen wouldn't let me buy it. So, but anyway,
I didn't say you could buy it. I said you had to bid.
Right, and this is a company that it was a gymnasium over. I think it was in Arnold, Missouri, or Fenton. Anyway, they're switching out all their gear, so they were going to give it to us, actually come and install it, and then for this 11.5, and it's 5 pieces, and they were going to do that for that. But there's no way for us to do it without bidding it out, and he can't wait 30 days. So, I mean, we pretty much lost that. So then I started thinking, you know, well, maybe instead of trying to skirt around and try to find these items, let's just put it in the budget, then we can take our time, put it out to bid, and just get what we need.
Well, and one of the other things I brought up was, I know we have people countywide that would like a gym room or some kind of, I mean, they're not just treadmills or bicycle machines or anything. So, and then also if we had it for somebody countywide, you know, who's going to maintain it, who takes care of them, who watches them, cleans them, and all that. So, I told Jonathan, put it in the budget, we can always nix it out of there if we want to. But it makes sense for them to have their own spot, because they have enough people for it.
Well,
So-
they're training to,
Defend themselves,
Yeah.
protect us.
Yeah.
Yeah.
I hate to say yes to something, it just kind of goes against my grain.
Damn, right that.
it's
What
recorded.
what is today? 22nd.
Yeah, I'm gonna take
Jeff.
You know, along those same lines.
win.
Yeah. Along those same lines is something that we can think about with the new health department building, if we have
Uh-huh.
room over there.
That's what I was
maybe we
thinking
could put
too.
Some room over that the employees could, if they want to, on lunch, or, you know, if they get off earlier, they want to go over and, you know.
And we
these-
do have some exercise equipment over there now, but the stuff that we have now has been donated, and it's breaking down, and, you know, so it's time for us to, you know, it's time for us to step up now and start and go in the right route with all this, so. Anyway, again, I'm not looking for,
I
I'm
think the
just,
conversation come up because he had somebody that had some, but I think they kind of closed their bid.
Yeah,
or
yeah,
whatever
it's-
on it
yeah, it's not
yesterday,
gonna-
and, you know, Kristen said we do have to bid it, and, I mean, I don't know how that works if you find a deal on it, like, you know, one of these listings or whatever and stuff. You find a deal on it, and then we can't even go and buy it because we'd have to bid it.
well, and the other good thing is by putting this in my budget for $20,000 in January, I can have the guys start looking again, and if we do run across a piece of equipment, then, and it's less than $4,500, then we could buy it right then instead of having to wait and do the, so it benefits us all the way around by doing it, and it sends a good message to my staff.
I just saw budget on the meeting today, and I didn't.
Yeah,
know what
no, I
it
think
was,
that's good.
I said,
So-
swing
And then
up
you
there.
got a high-speed pursuit vehicle in your budget too, right?
Yeah, that's right, $86,000, we're getting a red Corvette. It's a nice one.
High-speed pursuit vehicle.
Don't say no, you gotta wait. We're making it a prisoner transport vehicle.
Okay.
Strap them to the back.
All right, that's all I have. Thank you very much.
Thanks.
All right.
See you later, brother.
I wouldn't go, if I give him anything, I'd give him mopeds.
No there.
I got this on 22nd. Jeff said yes.
Electric bicycles, I want one of them too. They're only 2,500 apiece. They're good for hunting on.
Okay.
The first budget is actually your all's budget, 122. I did just change quite a bit of it, so if you want to look up on the screen there. We do have Tracy in there as a full-time, which wasn't in the printed copy, so it changed a lot of the benefits there. I also put the bond in there because one of you guys will be paying for your bond, right? Who's up next? Sam, yeah. So I put that in there, we'll be paying for it at the end of the year for that next year. Everything else was the same, so most you guys, same as what it is.
You didn't put anything in there for meeting travel and dues for us, or?
Yes, I
you
did put that back in there. Kristen mentioned that. 2,000, I put that back in there.
Hey, as long as you can get us out Mac training, I'm all right with your.
No, I don't think I did that. So the next one is 127. 127 kind of ties up GR, balances it all out from all the different departments that are in there. There's quite a bit of different kinds of revenue that come in there, anywhere from the stock insurance, financial institution, the local use tax money goes into there, and you could just go down and see what all goes in there as the 40,000 accounts there. You guys have any questions about any of those? Or doesn't look like,
What's the health insurance?
it's in and out of retirees.
Oh,
We bill them and then.
okay.
Same with office supplies, you'll see, we purchase all of it through there and then we quarterly bill all of the departments, so just an in and out kind of thing. There's still things in there that I would ask you about when it comes to that, like MAC, Mid-Mo Regional Planning, if those are things you still want to participate in 2018. But as for now, they're budgeted in there. Oh, yeah, those were economic development.
Where does the transfer in come from?
That's fees that are charged, the admin fees, I'm pretty sure.
The admin fees to the other funds. Where they come back in.
So there's a list
What?
of them there.
No.
Transfer in is,
transfer.
Yeah.
EMS's, rent payment,
Okay.
and then the, loan repayment from Union Water.
Okay. All right.
You guys are ready on economic development. I did not put a figure in there. That was one question I was going to ask you. You can see this year we had 5,000 for Salute, Chamber, Taste of Jeff City. I don't know if you want me to just put that flat dollar amount back in there for 2018 and discuss it later. It's totally up to you guys.
So we did have 2 additional ones this year. You did put some money towards the airport and the port feasibility study. So you're gonna.
We haven't got that contract yet, have we?
We haven't gotten it back. We have a PO out there for that, 47,600.
Yeah, we just approved up to that amount, but we haven't got an actual bill for that yet, so. I wonder if they're just gonna collect whenever they're done, because if it gets to the first 2 stages and we can't, it's just not feasible, then we're not gonna be billed for the rest of it, so.
Yeah, yeah.
Okay,
Yes,
all
they
right,
were-
sorry, keep going.
There was 2 of them, like she said, the 50,000 and the 4760, so.
Salute, Chamber, and what was the other one?
Taste of Jeff City.
Taste,
And then
okay.
I will put that air service back in there and a cost share agreement, if, just for budget purposes.
We already did the airport thing. It's not an annual thing, is it?
No, no, that was just,
That's a one-time thing.
yeah.
Okay. So if you got the rough number you want me to put in there, you just have to tell me. Budget was the same as this year, which we amended the budget, so.
I don't have any other recommendations and haven't really thought too much more about economic development or even coming up with something different. I know it's been talked about before about trying some different avenues for our economic development and, you know, what the chamber does, so. But I don't have anything to change
No, and I
for
think that-
18.
That would still take some time.
What's under miscellaneous?
It was just at that point, you guys were still talking about some of those other entities back then. That was in 2007.
Okay.
Right now, I'm gonna go ahead and use it for the cost share thing. So with those, we're up to 203. And again, that can change, that's no promises, that's just a placeholder for an amount, if you will.
I think we'd always kind of put 250,000 in there somewhere around that and just not, we didn't use it, we didn't use it.
The only thing we used to have in it was chamber.
What about that, I don't even want to mention it. I won't.
What's that, the economic development?
Yeah. So,
We can leave that.
that ask from the mayor,
Hmm.
but we can always decide on that later.
Yeah.
And the next one is the extension. I put that in there of what they were paying this year. I don't think we've received anything yet on them. Animal shelter, that's the agreement with the city. We pay 25% of all the calls that are within the county. Professional services, it's just whenever we need to hire an attorney or anything else that may come up in that nature. Insurance, I do bill out to the different departments with different funds, not different departments. Everybody else is in here except for road, bridge, sheriff, EMS. They pay their own insurance liability, but whatever's left comes in here. We talked about the MAC, mid-mo planning. Did you need to take that out? If we've even used it. We haven't this year.
What's that?
Mileage. You didn't use any last year.
I can put it in there. been taking, whenever you guys submit something out at 122. I can put the 200 back in there if you want, just in case.
Who would use that?
Maybe Janet, well, no, I'd take that out of 122. It would just be overage that you guys may need. Used to, I would meetings and travel out of here if it was meetings and travel that was associated with the whole county travel that you guys did versus your annual training comes out of 122. And mileage.
Well, if you got meeting, travel, and dues in there, you ought to have mileage in there. I mean, wouldn't you think? I mean,
Yep.
I don't know who's traveling out of GR, but, or does every department have their own meeting, travel, and dues? So where are we getting meeting, travel, and dues here? We spent $1,256. Is that just,
So you got 122 and 127 that you take them out of. How do you decide which one comes from which?
Well, like I said, if it has something to do county-wide that you guys are doing, or our monthly meetings that we have, or something
Okay.
different than just your annual training, I'll take out of here.
so like,
Your administrative meeting.
like a safety meeting or something?
Yeah.
Okay.
Well, we should have had MAC mileage taken out of this for the MAC training, because it's in Columbia.
And I've been taking that out of 122, out of your budget, our budget.
All right.
Very big material ones, but.
So it's if it's a general meeting of everybody or whatever, so.
So that's why there hasn't been any real mileage. Most of them are internal.
Right.
So capital, that's the purchase of the health department coming out of reserves within GR. Contingency, it's just a philosophy of where you want to be there. So, and then receivership will have, we've used all of that, so that is all gone on the window project, so. You guys have any questions about 127?
Nope.
No, thank you.
What was the next one? Corner?
Good, about that. Feeling that way right now.
Well,
Good.
we've had quite the rush on, I don't want to say that, autopsies. So, not sure if I increase that now or not. It's at 162.
Mm-hmm.
So it's different than what you had, what you
Sure if
gave
I
us?
increased it.
3,000 is what you're showing on here.
Right.
Oh,
What
there's
she
that
has in there.
increase. We're projected to go 33. I mean, we only budgeted 22, so we have had a rush on them lately, so we don't know. That is out of our control. So I could put it back down and take our chances and take a transfer again.
I mean, what's it hurt to put it in at 40?
It doesn't.
And not use it?
We don't wanna
Versus
get
having to do
dinged.
transfers
We don't want to get dinged by the outside auditors telling us.
For having too
we're not
much?
budgeting right. Huh?
for having too much in there?
Well, that our percentage of budget to actual doesn't, you know, they like to see it kind of the same, so if we
Just
over
base it off the
budget.
previous year then, maybe?
We can change
If you
it
have
to
a low year, then the
34.
next year you're gonna do transfers. If you have a high year,
Leave it at 37.
if we have a big year, then it's just the next year. I mean, then there's some kind of rhyme or reason to it.
Yeah.
Or was last year just a freak year because of the eclipse?
It fluctuates.
It
It fluctuates from year to year.
It's any suspicious death
I don't
or
know,
child's
what's-
death.
It don't really matter, I mean, you just
I was gonna say, I
look
don't know
at
if
it at
there's
the
any
end
rhyme or
of
reason to it. We just don't have to do transfers if we have too high, but I wanna get dinged by the.
Well, you wanna leave it at 37 from?
Yeah.
Why don't we just leave it at 37? And
Where we're at now, so hopefully
Yeah.
we'll make it the rest of
just
the
leave it
year.
at 37.
The next one is 165, that is the transfer that was promised, I should say, to the law enforcement fund when we did the bond issue. and that was $2,040,000 at the time is what general revenue was giving to that fund. I've subtracted off the computer services allocation that we charge the funds, and I did increase the admin fee up to the, I didn't change the description there, but it's 3% just like every other fund. So that's why the increase. Last year was the first time in several years since we've had the law enforcement fund that we even had an admin fee. We didn't go back and recoup anything. We were just moving forward at 1.5%. But in 18, I have 3% in there.
Okay.
So this subtracts off, so then we would transfer 1.8 million.
Okay.
Okay.
So I have domestic shelter 311. There's not really any changes though.
311, that's just statutorily, we have to budget that, so it's based on, I just did whatever we did this year. It depends on the carry forward always.
Okay.
Okay.
620 is the health insurance fund. I guess basically the only question there is the wellness. I hear different ideas that you guys are talking about today. Some of them may not be able to be pushed into this fund, you know, as long as it's available to every county employee, that may be an option to push some of that in here. I guess I put 50,000 back in there, what we had in there this year for wellness. But the rest of it is basically, we'll be having meetings shortly on projections of what the health insurance will cost next year. Don't have that information yet.
So you're projecting that we will charge in fees $2.3 million, basically.
I'm just going on what it's projected to end up this year.
Right.
Yes.
But that's the fees we'll collect throughout the year.
That's the payroll amount.
Right.
Yes.
And then the cash that we'll have 1.8 million by the first of the year, or?
You're hoping into the year, that's where we're gonna be.
Okay. And then our contingency is 1.9 million.
Yes, at this point. And that will fluctuate depending on the carry forward. As we get towards the end of the year, we're always never sure how much will go into reinsurance.
Mm-hmm. And then we paid you're thinking we're gonna pay 2.3?
Mm-hmm. In claims based on,
Okay.
this year we're based on 2.18, so.
So it's basically a break even. Okay.
Well, we do have 2 sales tax going on this year. Christian would like us to kind of reduce it more before we combine it into the next 5-year sales tax. So what I did was I just gave you guys the spreadsheet a couple weeks ago through an email of where we stand right now as far as income, as far as what we have to spend, and the projects that we're looking at. As of on hand at 8/14, we have about $1,095,000. Make sure I'm right here.
And money we've got projects for?
Is that including the extra revenue for the rest of the year?
That's the total of expenses that you have projects for there, right?
Actually, cash in the bank at the end of the year, if we don't spend any from now on. Basically, cash on hand, $1,095,000. Projects, current projects list that we're looking at, this one is actually getting paid, this pay period, or this accounts payable. Brooks Park, the remaining balance of that, we paid some of that. We still owe on the painting around here. We still have tax increment financing going out. I don't know where we are on the sidewalks and railing, but there's an estimate. There's the juvenile copying machine we just approved last week. Recorder, you guys promised to pay for part of that desk situation there downstairs that we haven't gotten yet. Computers, that's just a plug figure that we're still, some of those switches and stuff that he hasn't replaced yet. So we may or may not spend all of that this year. Sirens, that bill was still out there, wasn't paid yet, so. Parking lot, I don't know, parking, okay, well, 911, I'm not sure if we're gonna get that or not. So, open balance, after everything up there was paid, and additional sales tax money from now to the end of the year, I'm looking at an estimated carry forward of 7.78 if all that stuff gets paid. In 2018, we'll get another 935,000 of our 15%, everything remaining flat. I didn't increase sales tax. So then we'd have 1.7. So these were some of the stuff on Greg's list as far as projects for the upcoming
778,000 plus.
1.7.
Plus 935 coming in at
That's the
18.
estimate for next year.
Yeah. That's
935, okay.
Yes.
You're just flying through
So-
every time.
Sorry.
You should have
Follow it all.
1.7 between what you're carrying forward and what you bring in next year.
And so I kind of did it by priority A's that Greg had on his list for the different buildings. No certain list of these A's, just put them in there. So it's totally up to you guys. And I'm not asking you to make a decision now. I'm just telling you what's out there, what Greg submitted. By no way, I just want to plug a figure in there and then we'll go forward as to what you guys think is the most important. But by the time we reach the end of the budget, we should hopefully know what we want to do in 2018. As you can see, some of these projects would take it all if you picked a couple of these projects. So, and keep in mind that 913 comes at 935,000 comes in monthly. So you're not going to have all that money at the beginning of 18. So, but you'll have around 800,000. And I did put some things in here for the new building. I just don't, these were actually what Greg came up with. So I know I heard Christy say she was still waiting on some figures, so. Of course, those are the new building, not anything to the old. And so then you can see priority B is in the next 3 years, Greg thinks should be done. Now, if we talk about,
Yeah, get rid of that old generator, yeah.
yeah, those things would go away if we're talking about moving IT
Yeah.
over to this year. But also then I would have that expense I just heard today too, which is not as much as I thought it would be, to be quite honest. We have some, I don't know, you'd have to ask Greg about these estimates, but I think he's talked to people about it. I mean, it's going to be pretty expensive to do the wiring, the plumbing in the courthouse.
Yeah.
And then we, some of these highlighted things, some of these things could be paid out of other funds, if you so choose. And then the 5-year plan of what needs to be done. And as you know, this is an ever-revolving, stuff comes up in these buildings to maintain. So, you guys got any questions or?
We're gonna go ahead and do the landscaping this year, Chris, or? I know the DAR wanted to know, because they wanted to plant that tree, but there's,
So what, and we heard some other requests today from juvenile, from the generator part, and then health department. I think we got some of that covered here. GIS, the sirens, and then we also heard from your reverse 911, which I'm gonna go ahead and put that in 650 EMS sales tax instead of in here. And then you guys talked about a central maintenance type project. So all those things. But we can go back over to the budget part. I'll show you what's in there as far as that goes right now.
You gonna split reverse 911 into out of
I can.
EMS and sheriff?
Yeah.
I think it should be split.
It's gonna be up to them to accept that into that change into their budget. I can put it into our final budget. I'm not sure if they're in on that or not. But as far as what I had in there
Right
was.
now, it won't be in their budget.
Yeah, I'm sure it won't.
I'm sure.
Here's the 935,000, which is basically, it looks a lot more than this year, but remember, we put the first 1 or 2 payments into the old sales tax, because that was part of the old sales tax money. This was just, I think we had just 1 month. 1 month that we put in the old sales tax. But 935 is where we're gonna end up this year, I think. Brooks Park, if we get it done, we get it done this year, get the money back in. I'm not sure if we will. Carry forward. It depends on which ones of these projects we get done. I don't know. We get a little interest, tax increment finding, we talked about computerization. I just got that this morning, so I'm gonna fix that from what Brian gave us. And then the rest, I was gonna have a contingency, so it's more like, what do you think the contingency should be? The rest of it is kind of saying, you know, what do you feel comfortable with a contingency in there? And then the rest of it I will plug into capital. And then you guys can decide on which projects you want to do at a later date. I don't know why I came up, I think I balanced it out with 209 right there. But if you want 500,000 in contingency for things that may happen in these buildings that are technically not planned in an emergency that we got to fix in 2018.
I think we had it a lot higher at one time and we reduced it down to 200.
Well, by the end of our 5-year cycle of that sales tax, you know,
We wanted to spend it.
we want to spend it down because there's, you know, we promised that we'd spend that money in that 5 years and we did. So that's why. But if there's one of those projects that are bigger than the other that you want to build up the money for in 2019, then that's where we should up our contingency.
So I think we need to start building it up again now, because we're gonna have some big projects in there that we're gonna need money later on for.
And it's kind of what we did this year because we really didn't do very many projects, big projects this year, because it was our first cycle of the 5-year.
Do Wildwood.
Other than this model.
Well, that comes out of Public Works.
Oh, yeah. We could do much of it.
So I see both sides. I mean, obviously, you could increase your contingency and build up your reserves so you can do a bigger project, but it seems like when I first came on, the problem was we were building reserves, and we never did anything. And so then you kind of get in that mode of, oh crap, now I got to pay catch up and I got to do all these projects and the price tag's so high that, you know, it.
We had the old jail
Yeah, that was
project,
why
was
we
one
were
that we
saving
were
money
kind of
for.
sitting on there,
Mhm.
and then we had it built up, and we had stuff built up, and then now we purchased the health department. So I think we need to start building back up. But we can talk about that more whenever we get into the
I think so.
weeds.
I think the Carnegie building's probably gonna be,
And I think there was a lot on that.
there's a new roof, there's tuck pointing, there's ceiling.
A lot of these things right here. And that was in the priority A.
Yeah. So I think.
It was a roof replacement and
Yeah.
and the ceiling, the tuck pointing and ceiling.
Yeah. Then you got it pretty much done.
I'm just kind of in a little shock that all those for the new health department are in priority A.
I think his idea was to do all those things before people move in would be easier or maybe less expensive. I don't know. And maybe some of them need done right away. I have no idea. Well, we know that.
I think we ought to have a meeting at some point to try to
Mhm.
get some of these on the target for next year, see what we want to do, and then try to get those bid like the end of this year yet, so that they can be ready to go come next spring.
My numbers are a little different than yours on carried forward, so I'm careful when you know, because you have 1.6 plugged in here, which is two together.
So I think rough Jim Wish said probably could, it's good for another 3 years.
What's that?
The roof at the health department.
My roof is good for about 3 more years too, but it's gonna be about 10 years, and it's gonna get patched.
Yeah.
So,
Yeah.
I have a feeling a lot of it can go a lot farther than the 3 years.
Yeah.
It's not something I don't think has to be done right now. But it would be nice if we did have the money sitting there to make it all like new before they get moved in there. And then you know it's good for 20, 30 years. I don't know what them roofs are. That's a flat roof, isn't it?
It's
Or is
flat.
that- Yeah.
Mhm.
Yeah, so, let's talk about that, we'll just talk about that when we do the
Yeah.
kind of stuff. I mean, it's already 12, we still gotta talk to Jerry,
Yeah, we
we're
still
gonna be
got-
until 3.
yeah.
I'm getting hangry.
Hangry?
That's not gonna do it. I need protein, man, like real protein, like
Okay.
deer. Vince, like
Deer.
a cute little animal that can just devour it.
So maybe I'm not.
I know-
Rack 'em and stack 'em, huh?
Okay, yeah, not
Ted
them nuts,
Nugent.
some- my food eats that food.
Okay.
Okay, we good?
It's been a long while.
I think the only other thing you had was that financial institution tax.
So that one, we used to have a department in general fund 123 called general distribution, which was pretty much the in and out of financial institution tax to the smaller cities and things. Every year, we have to move that into its own fund. Well, since we consolidated some of our cash together, we decided to budget that in the fund that it actually flows through for financial statements, so that's why you're seeing that.
Okay. It's a new fund this year.
Yep. Okay, so as you know, then it will go from here to the auditor via on computer, and then she'll have to, the next schedule is back to us by November 15th, 14th. I'll have to see when it's scheduled, but it's on the agenda already.
What is our total budget then compared to usual? I mean, overall, is it a little more, a little less, about the same?
Most departments had an increase today, so that's your.
I noticed that.
Submitting an
But,
increase.
you know, I would do that too, you know, ask for the moon, get an eclipse or something, but anyway. So you're gonna ask for more at that time when you're asking for it. I obviously make cuts, but is there any big changes?
All the rest of the elected officials' budgets and stuff don't have to.
September the 1st.
Right.
Oh, so we haven't seen anything. Okay.
It's just ours.
So we're working on getting ours.
I may be asking for some answers to some of the questions as far as things that people requested as what kind of priority you guys want to put on it, because there looks to be some cuts that need to be made this year, so I might be coming back on these departments that came and saw you today. Try and get an answer before I submit my budget to you.
Yeah, that's understandable. You could just be the bad guy and cut the ones out, cut them all out.
And I'm gonna have to ask if I can move the public hearing on the tax levy to the 31st instead of the 29th. My error, I didn't get it to the bank for the 7-day, or to the paper for a 7-day notice. I thought it was a 5-day notice, but by statute, it's a 7-day notice. So they can't get it in the paper till Thursday.
So the 31st, we're here anyway
Yeah,
with,
you guys, I noticed you guys have an agenda that day too, so if I can move that.
You're the one that put that on there.
I know, dang it.
well, basically.
I noticed
mean,
y'all had one because I put it on there.
That's mine.
I don't care, switch it. I'm good with it. I'm good.
It
Yeah.
won't take that long.
No, it won't take, yeah.
Okay, thank you. That's all I had then. I gotta get this to
Okay, what else we got?
And how, we got 9 to 12, yeah, really, that's not 10 minutes, we're 10 minutes behind. Anything else before we go into closed session?
Oh, where are we at on prisoner per diem reimbursements? Do we have all the papers submitted and stuff for it? Did we talk about this last week?
Yeah, we
did.
did. We did.
Okay.
I think we're 2 months behind on submitting our paperwork, and they are 6 months behind on reimbursing us. But I'll
Okay.
have to double check that when I get upstairs.
But I understand they're behind because they don't have the money in the budget. They're 17 million behind already. But a lot of other counties don't even have the paperwork in. So that's just where I was wondering where we were at. So, and that doesn't seem to be outrageous to be behind on that for 2 months. Getting the information from the sheriff to the clerks and judges have to sign off on everything. It's all gotta, okay. Well, that's not bad at all. Apparently there's a lot of counties that have a lot wrong with it. I don't know if you've heard anything about that stuff, but.
I haven't. But, I mean, you see more of these guys with MAC and probably talk about that more often at the MAC meetings and.
Yeah, what's the name down at Cape Girardeau?
So it's a fairly substantial amount of money that we request from the state monthly for prisoner reimbursement that they're 6 months behind on reimbursing us for.
Basically, they get their check each quarter, and they go in the order that they've received it, and then they catch it up to there. Once they run out of money, they're done. Because I guess this DOC is the one who writes the checks.
Right.
They don't owe people the money for it, they're just the middleman for
Well,
it.
usually we'll start seeing checks in July when their budget gets approved again, and we'll see it until the money runs out, and then we won't see money again until next July.
Robbing Peter to pay Paul, huh?
Just tell them, put the money in the budget to get them caught up, and then they'll be paying monthly on it. Yeah, I'm not sure how they get by with all that. Take their prisoners, handcuff them, and go put them on Capitol steps. And then, there you go. Send them a late remittance bill, and they can charge them interest.
You just cuff them and tie them to the governor's
Debbie, I
mansion.
got this.
All right. That's kind of what I was curious about. Thank you.
Okay. Anything else? I'll make a motion to go into closed session. Me too.
Go ahead. I'm
Okay.
trying to get these bills paid.
Make a motion, we go into closed session pursuant to section 610-021 of the revised statutes of Missouri, concerning personnel issues, section 610-021-3.
Second.
Roll call?
Sam?
Yes.
Jeff?
Yes.
Chris?
Yes.
Okay.
Here's the boys' room real quick. Hey Jeff, is Eclipse gonna be on the front page of the paper this morning? I didn't get out there, it was raining.
That was, I took the call.
I'm sorry.
And the guy was dead serious. I just wondered.